Tes 1, 2, 3. Pagi, Pak. Halo, Assalamualaikum, Pak. Sehat, Pak? Oke, siap. Baru nyampe kantor. Pak, jadi yang persenannya itu 40. Jadi pembayaran yang sudah memenuhi 40% dari total gitu kan ya, Pak ya? Oh, yang dicatat itu sisanya. Jadi kalau misalkan dengan logika oh gitu. Berarti syarat cetaknya kalau misalkan mau pembayaran minimal 40%, saya isinya 60%.
Pagi semua.
Pagi Bu Iga.
Tes, tes. Kedengeran nggak, Bu? Tes, tes.
Ya, kedengeran Ibu.
Oh ya, terima kasih.
Sama-sama.
Udah, Pak.
Di print di mana nih, guys? Itu saya mau print di rumah, Bu. Yang Ibu share itu, Bu, di grup. Iya. Oke, Pak. Oh, iya.
Selamat pagi, Bapak dan Ibu.
Ya, selamat pagi Bapak.
Selamat pagi, Pak.
Selamat pagi.
Ada kedengaran suara saya, Bu?
Terdengar Pak?
Terdengar, Pak, tapi agak kecil.
Agak kecil ya.
Ya.
Tes 1, 2, 3. Selamat pagi, Bapak dan Ibu.
Mantap.
Apakah sudah jelas, Bu?
Sudah, Pak.
Di kami cukup jelas Pak di Pelni.
1, 2, 3. Sebelah kiri.
Apa deh?
Tes 1,
Coba
2,
agak
3.
jauh Pak.
Oke, Bona. Pas.
Oke, mantap.
Oke, mantap.
Yang ini ibu-ibunya ini apa? IT. Oh, iya.
Good morning.
Pagi Bu Sam.
Udah masuk nih gua nih.
I'll try. Halo. Halo, halo. Halo.
Ya, Pak.
Oke. Bu, ini yang dari Profesor Fang yang dari Taiwan.
Iya, Pak.
Ya, kami mau uji koneksi, setelah itu mungkin kami mute. Jadi nanti pas Profesor Fang untuk menyampaikan speech-nya, supaya tinggal gitu loh, Bu. Tinggal langsung gitu aja sih.
Siap, Pak. Siap, Pak.
Oke, baik. Saya atur posisinya sebentar, sama saya lihat apakah suara dari sini bisa terdengar jernih oleh peserta gitu ya, Bu?
Baik, Pak. Baik. Siap.
Baik, baik. Profesor, you will sit over there or?
Yes, I will.
Okay, we just try.
Yeah, but I need to just.
Oh, have electricity. Okay. Maybe for a while, Professor. Just to
Just
position, yes.
Oh, okay, no problem.
Just for position. Maybe we will sit here.
Yeah. I think so.
Good.
Where is the camera?
This one, brother.
Okay.
The iPad in the left side.
Why is a little just? I mean,
Yeah,
in the
it's
right
good.
side, right?
Yeah.
Not.
Wait, brother. In like here.
Oh, so because.
But I think it's like here because the background will be like this one.
But they will show up my slide, right?
I will ask how will be control the slides.
Yes, I think maybe.
Okay, Professor, I will ask to them. Halo, Bu.
Pak, iya, Pak.
Yang sudah jelas, Bu, ya, gambarnya pertama jelas?
Gambarnya, bolehkah dibantu saya nggak melihat Bapaknya nih. Bolehkah di speaker tadi disorot ya? IT, please.
Oke, siap, Bu.
Wait, they just...
Ya, Pak. Permintaannya ibunya mau presentasi langsung boleh, kami yang memfasilitasi boleh?
Ya, and enaknya mungkin dari panitia ini, Bu, ya.
Boleh.
Professor, you can choose. You control your slide, or they will. You just say next.
I can control. I hope that I can. Yeah, I would like to control.
Beliau rencananya mungkin screen share, Bu.
Ya, beliau sendiri ya, Pak.
Screen share by herself. Kemudian nanti Ibu memoderatori aja, kayaknya gitu.
Siap, Pak. Baik.
About the picture, Bu, apakah jelas nih? Nanti peserta bisa melihat ya, Bu?
Iya, siap. Jelas,
yang pertama.
Pak.
Yang kedua tentang suara, ini kami tidak menggunakan mikrofon. Tapi apakah oke suaranya, Bu?
Jelas, Pak, jelas.
Jelas ya, Bu?
Ya.
Oke. They say everything is clear about the picture and the sound. You didn't need to have a microphone. It's clear.
It's clear. Okay.
Yeah, and then
so
I use screen share, Professor, for the slide.
You can try to screen share by yourself, ma'am.
So I need to upload my slide because I have sent them my slide. So I'm not so how to control my slide by myself?
I think when you want control yourself, you just put your slide in here.
Yeah.
And you open it from your iPad, and the name is screen share, Professor. Your screen, it will be the screen.
Yeah. So but the function icon.
Oh, this one. Oke, Bu, kami akan coba screen share ya.
Ya, boleh, Pak.
Oke. I never use. I think this is screen share, Professor.
Yeah.
Yes. So the first, you go to your file and open it the PPT and then screen share, Professor.
But I think I need to
maybe download it. It's just the first is the minimize.
So I Need to open the file.
Yeah, in the icon. Yeah.
Gak ada sisir yang rata apa ya?
Di grup IT ada ibu kan?
Ada.
Ya, ibu coba ingat aja.
Ini ada yang mana?
Ini bergema.
Ini kita harus masuk semua, udah masuk. Jadi nanti kalau udah banyak orang kita susah masuk, ini saya susah masuk. Ini siapa yang mau saya?
Belum masuk.
Belum. Tadi udah dibilang Pak David Bu di grup. Iya. Belum dimasukin sama Bu sama aja.
Halo Bu.
Iya Pak, iya Pak.
Kita mau ganti laptop Bu, nggak di iPad karena kayaknya kesusahan di sini dari iPad ke situ.
Sebenarnya kami bisa bantu share screen loh Pak, beliau tinggal bicara.
Nggak tahu orangnya minta gitu, saya nggak berani.
Oh baik.
Saya sih prefer gitu juga, tinggal bilang next kan beliau.
Iya.
Coba Bu, ini ada komputer, laptop sedang apply. Siapa tahu, coba diterima dulu Bu.
Namanya apa Pak? Nama perangkatnya?
Saya cek Bu. What's the name? The same, Professor Shinkan. The name. They will accept your.
Okay, so I just need to accept because this is.
Yeah, the name. Sandra. Namanya Sandra Bu.
Sandra, sebentar ya Pak.
Sandra Indonesia, kayak nama Indonesia Sandra.
Di sini Oppo.
Oke, saya bantu accept kali ya Bu ya.
Iya, silakan Pak kalau udah ketemu.
Sudah Bu. Atas nama Sandra.
Kayaknya Sandra sudah ini Bu. Oke. Kita coba cek yang di sana gitu.
Ya, silakan Pak.
Nah, it's easy using the computer. So the first, you must open it first.
Gue cerita bahwa di sini tuh ada sate marangi.
Sate marangi itu
ditagi, buset deh.
Pada peserta.
Mas Dani.
Siap Bu.
Halo Bu.
Ya Pak.
Ini sedang mengaktifkan yang satunya ini, mau kita matikan aja biar nggak berdengung.
Bisa Pak, bisa. Di maximize mungkin Pak.
Slideshow.
Good. We try to connect it. Halo Ibu.
Pak, iya Pak.
Ya, kami coba untuk slideshow ya Bu.
Ya.
Untuk screen share ya sekarang.
Ya.
Now we try to screen share. We test it. No, Professor. Is this screen share now?
Yes.
Okay.
But 可是我怎么看得到我的 slide 可以控制？
老师其实现在都可以控制，对方是看得到老师在跳。
真的吗？那我看，所以我只能
Okay.
看我自己的。
Halo Ibu.
Tuh.
Udah ngelihat slide kami?
Sudah. We can
Saya coba ganti slide ya.
Yes.
Kelihatan ya Bu?
Ya.
Gambar peta dari WHO.
Siap.
Okay, clear Professor.
Clear.
So
可
it's
是我
just
就看不到我自己。对，
it's just
老师，所以我要。
yeah.
那我可能要。
Your face still here
对
and
我
we
自己
also
在那。
and now we escape and then stop screen, stop share,
停止，这里有一个停止分享，
stop share.
然后
那我
就会跳回原来老师就是他们的那个视窗这样。
那我等一下要再分享的话，我就是再分享画面，
Yeah,
对不对？对，好。
Just press this one. I will get you when you started.
然后就分享这个。
Professor mentioned that there is a link in PowerPoint, so maybe if Professor click the link, you have to reshare
I still need
I still
to.
no. It will automatically right? No.
Really? Because I click every time.
Or just we will get the because in still in the screen.
Yes.
Will be auto to listen because we just share the screen, right? Internet it will be here.
As I know, because I only click on for sharing. So if I click the web, there will be another screen. So
okay, I will try to.
Because every time I re-click to share the
we just
website.
we try now.
Oh, okay. 老师可以先选一个有那个的哈。对。
先关掉。
Not yet, right?
Not yet.
Not yet. Okay, it will be good. But
so
we try in the screen share, right?
So I need to share this.
Yes.
Right. So I need to share the link.
Oh, okay.
This one first.
This one first.
To try share the PPT first. And click the link.
And click the link, yes.
Link.
Maybe if they can see this.
Okay. Halo Bu.
Iya Pak.
Kami mencoba membuka link karena nanti ada yang kami jelaskan dari link. Apakah linknya ini bisa dilihat Bu?
Linknya kami bisa lihat, tapi sesudah dibuka belum kelihatan. Maksudnya sebelum.
Oh, they cannot.
So you have to reshare. Click the new sharing and this one.
Okay, and share
and then
again.
Share again. So maybe they can see.
Ini kelihatan nih.
Okay, they say okay, Professor. So if we click the line, I mean the link, it will be the new screen share, right?
Yes.
And we go back and screen share again.
Yes.
Okay.
If you want to go back to the PowerPoint, you have to reshare the PowerPoint again.
Okay.
So I need to stop the share, and I need to share another one. This one.
Yes.
Go back to this one.
If you back in here, but if you click the link, you must.
所以我如果可以先开启我自己的 link 吗？还是不用？
老师其实可以不用先看，要不然他会跑出很多页面。就是老师可能在分享这个的时候，你点这个好了，然后就按新分享，然后再选那个
应该是这个，对，
选这个，然后按分享画面，他就会看到这个。
OK。
然后其实不用再停止分享，就是如果要回PowerPoint的话，就是按新分享，
再回来，
按回来。分享画面就会看到这个
好，就是要有一直这样换来换去，对，好，谢谢 Tina，OK，Thank you Tina，
有需要再跟我说，
真的很复杂。Stay here to help me.
For the mental support.
Technology support. Okay.
Thank you. Bye.
Bye.
And just close.
Yeah. So I can.
Yes, just escape.
I think I can just wait for a moment.
Yeah, wait.
So I because I want to.
Sure, Professor.
Yeah.
You can close. You close your camera.
Mute.
Oke, halo Bu.
Ya Pak.
Kami sudah siap, tapi ini kami close sebentar. Nanti kalau waktunya kami sudah siap kok. Saya standby di sini untuk mengasisteni beliau.
Siap Pak.
Terima kasih Bu.
Bapak dengan Bapak Wantonoro bukan ya?
Oh, bukan.
Bukan ya? Oh baik. Siap.
Saya
beda Bu, itu Pak Denny namanya.
Oh, maaf Pak. Baik Pak, siap Pak.
Pak Denny.
Oke.
Assalamualaikum, selamat pagi. Assalamualaikum, selamat pagi.
Selamat pagi, Pak.
Waalaikumsalam warahmatullahi wabarakatuh, Pak.
Waalaikumsalam, selamat pagi.
Warahmatullahi wabarakatuh. Selamat pagi, Pak.
Pagi,
Selamat pagi, Pak.
Pagi.
Pagi.
Selamat pagi, Pak.
Pagi, Pak.
Jakarta 3.
Pagi, Pak.
Pagi, Pak.
Pagi, Pak.
Pagi, Pak.
Selamat pagi, Pak.
Good morning, ladies and gentlemen. Welcome to the 4th International Nursing Conference, Medical Surgical Nursing Adaptation in Pandemic COVID-19.
Selamat pagi Bapak dan Ibu serta saudara sekalian. Selamat datang dalam seminar keperawatan internasional yang keempat dengan topik adaptasi keperawatan medikal bedah di masa pandemi COVID-19.
International Nursing Conference is a collaboration of 5 nursing diploma academy in Jakarta, Indonesia, namely the Kris Husada, Pelni Jakarta, Pasar Rebo, Fatmawati, and Council of Churches in Indonesia, Cikini.
Seminar internasional keperawatan ini adalah kerjasama dari 5 akper, yaitu Akper Kris Husada, Akper Pelni Jakarta, Akper Pasar Rebo, Akper Fatmawati, dan Akper Persekutuan Gereja-Gereja Indonesia Cikini.
I'm Susiana Johnson. I'm pediatric nursing lecturer in Nursing Academy of Pelni, Jakarta. I feel honored to be your MC today. I will lead this conference in English.
Dan saya Eltania Giovanni. Saya adalah tenaga kependidikan dari Akper Persekutuan Gereja-Gereja Indonesia Cikini. Saya merasa terhormat dapat menjadi MC pada hari ini dan saya akan memimpin jalannya acara seminar ini dalam bahasa Indonesia.
First of all, let us say thanks to God Almighty who has given us this occasion to hold the International Nursing Conference.
Pertama-tama, marilah kita bersyukur kepada Tuhan Yang Maha Esa karena telah dapat diberikan kesempatan untuk mengikuti seminar internasional keperawatan ini.
Before we continue with our agenda, we are going to show you list of the rules for our conference today.
Sebelum kita memulai acara, berikut tata tertib acara kita pada hari ini.
First, after joining Zoom meeting, please switch off your microphone and switch on your camera. During the presentation, the host and co-host will have complete control over the audio or speaker.
Setelah masuk ke dalam aplikasi Zoom, mohon setiap peserta agar menonaktifkan suara, namun tetap mengaktifkan kamera. Dan pada saat presentasi berlangsung, kontrol suara sepenuhnya akan dipegang oleh host dan co-host.
Second, please write your ID using your full name and not the name of your device.
Semua peserta diwajibkan untuk menuliskan nama asli pada aplikasi Zoom dan dimohon untuk tidak menggunakan nama perangkatnya.
Third, if you have any question, you may ask your question using Zoom chat room or YouTube. And don't forget to also write down your name along with your institution name.
Pertanyaan bisa diajukan melalui chat Zoom room atau YouTube dengan tetap menuliskan nama dan asal institusi.
Fourth, the certificate will be given to those who have already registered and filled in the evaluation link.
Sertifikat akan diberikan kepada peserta yang telah melakukan registrasi dan mengisi link evaluasi.
Fifth, if you can join in Zoom application, please see in live streaming YouTube the link address in your screen.
Apabila Anda tidak dapat mengikuti di aplikasi Zoom, maka Anda dapat menyimak melalui live streaming YouTube dengan menggunakan link yang tertera pada layar.
And last, we hope all participants to be able to take part in the webinar until it's finished and without any disturbance.
Semua peserta diharapkan agar dapat mengikuti kegiatan webinar hingga selesai dengan tertib.
In this moment, I would like to welcome the honorable guest, participant, presenter, and also the respectable Professor Su Ying Fang, RN, PhD from Taiwan. Associate Professor Regidor Terdioso, RN, MSc, PhD from Malaysia. Mr. Wantonoro, MCup, Nurse, SPCup, MB, PhD from Indonesia. Dr. C. Kaniamal, MSc, PhD, Dean of SRM College of Nursing from India. Mr. Harif Fadila, SKP, SH, MCup, MH, General Chief of Indonesian National Nurses Association. Mr. Dr. Nurse Trimaya Cahya Mulat, SCup, MM, MCus, representing General Chief of the Educational Nursing Vocational Institution of Indonesian Association. Ms. Silvana Evelinda, SKP MKep, Chief of Regional 3 of Educational Nursing Vocational Institution of Indonesian Association. Nurstati Setiarini, SKep MKM, Director of Nursing Academy of Keris Husada. Ms. Buntar Handayani, SKep MKP MM, Director of Nursing Academy of Pelni, Jakarta. Nurse Iga Dewi, MKep, SPKep, AN, Director of Nursing Academy of Pasar Rebo. Nurse DWS Swarsa Dewi, MKep, SPKep, MB, Director of Nursing Academy of Fatmawati. Nurse Yeni, MKep, SPKep, MB, Director of Nursing Academy of Council of Churches in Indonesia, Cikini. Ladies and gentlemen, please give appreciate to all of us and especially to our speakers today.
Para hadirin sekalian, mari kita berikan apresiasi kepada kita semua dan para pembicara kita.
Thank you. As we are about to begin, please be seated and kindly switch off your microphone on Zoom to avoid interruption.
Kita akan memulai acara kita. Diharapkan kepada semua peserta untuk duduk dan menonaktifkan mikrofon atau suara di Zoom untuk menghindari gangguan.
Ladies and gentlemen, on this conference, let me inform you the structure of the agenda for today. First, opening ceremony. There are national anthem followed with Mars Indonesian National Nurses Association. Welcoming speech from Chief of Indonesian National Nurses Association. And next, welcoming speech from General Chief of the Educational Nursing Vocational Institution of Indonesian Association. And then, welcoming speech from the Chief of Committee. And pray. Second, conference session. Third, discussion session. Fourth, oral presentation. Fifth, discussion session. And the last is the closing ceremony. Now, before we start the main agenda, we will listen to the national anthem Indonesia Raya and followed by Mars Indonesian National Nurses Association.
Sebelum kita memulai acara utama kita, marilah kita terlebih dahulu mendengarkan lagu kebangsaan Indonesia Raya dan diikuti oleh Mars PPNI.
To all attendees, please stand up and kindly switch off your microphone and camera on Zoominar.
Kepada semua hadirin, dimohon untuk mematikan mikrofon atau suara dan menghidupkan kamera di Zoom.
To all attendees, please be seated and thank you.
nasional Indonesia, wujud ikatan profesi perawatan, tempat membina dan mengembangkan kemampuan diri dalam membuktikan keberadaannya. Menapaklah dengan keyakinan lebih pasti, sejajar dalam abdikan diri, bangkit berdiri dan langkahkan kakimu itu, menatap hari esok penuh asa. Wahai perawat Indonesia, bangkitlah dan majulah untuk menolong sekalian yang menderita. Kuatkanlah pribadimu, tingkatkan pengetahuan untuk memberikan asuhan keperawatan. Kita melangkah untuk mengisi pembangunan bangsa negara Indonesia, untuk menghantarkan bangsa menuju sehat semua dengan semangat jiwa Pancasila. Maju perawat, majulah dalam kancah pembangunan, tunjukkanlah pada sekalian orang. Jadilah perawat model kesehatan bangsa kita, jadilah teladan dalam hidup sehat. Bangkitlah perawat seluruh Indonesia dalam mengemban citra profesi, menjunjung tinggi kode etik keperawatan, laksanakan panggilan tugas mulia, mencapai derajat kesehatan seoptimal mungkin bagi warga negara Indonesia. Sebagai bukti kiprahnya mahkota putih suci dalam mendukung pembangunan kesehatan. Dengan organisasi PPNI yang kokoh, padu bersatu, serta selaras, perawat Indonesia akan mampu angkat citranya di mata insan dunia.
To all attendees, please be seated and thank you.
Para hadirin dipersilahkan duduk kembali dan terima kasih.
Come next is welcoming speech will come from the General Chief of Indonesian National Nurses Association. Ladies and gentlemen, please welcome Mr. Harif Fadila, SKP SH MKEP MH.
Berikutnya adalah kata sambutan dari Bapak Harif Fadilah, SKP SH MKEP MH, selaku Ketua Persatuan Perawat Nasional Indonesia. Kepada Bapak Harif Fadilah, dipersilahkan.
Baiklah, Assalamualaikum warahmatullahi wabarakatuh. Good morning, everybody, the participant. Firstly, I would like to thanks to the committee to you have invited us, the Indonesian National Nurses Association, to this seminar to contribute for this seminar. So, firstly, the Honorable to Chairman of Akper Pelni, my colleague Buntar Handayani, Academic Nursing Pasarbo, Nurse Dewi Purnamawati, Honorable the Chairman of Akper Cikini, Nurse Yeni, MKEP SPKMB, the Chairman of Akper Kris Husada, Nurse Tati Setiarini, and the last, the Honorable Chairman of Akper Fatmawati, Nurse Warsa Dewi. And then the Honorable, our guest speaker from other country, my colleagues from Taiwan, from Malaysia, from India, and the Honorable, of course, from speaker from Indonesia, our colleagues, Mr. Wantoro, PhD. It is my eighth month since it was first confirmed. while the nursing force in various health facilities was given task to care for the COVID-19 client or patient. Nurses need to provide their service in other field of healthcare still. Therefore, nurses need to keep their knowledge and skill level updated to the current science and affair in healthcare. As the professional organization of nurses in Indonesia, PBNI support activities that add to the body of knowledge of nursing. This international nursing conference with the theme Medical Surgical Nursing Adaptation in Pandemic COVID-19 is one such activity that we positively welcome. The COVID-19 pandemic indeed brings complication to our profession of nursing service in healthcare facilities. And nurses do need to adapt to the change it brings. In this seminar, as the president of PPNI, I hope nurses and nurse students participating will gain further knowledge in the professional practice of nurses and the adaptability of the nursing practices in a particular situations, such as the current pandemic. The last, do take this opportunity to learn and gain knowledge as much as you can. And I hope you will have fruitful participation in this seminar. Good luck and thank you very much.
Thank you to Mr. Harip. The next welcoming speech will come from the General Chief of Educational Nursing Vocational Institution of Indonesian Association, represented by Dr. Nurse Trimaya Cahya Mulat, Eskep MM MKes. To Dr. Trimaya, please welcome.
Berikutnya kami akan mengundang Bapak Dr. Nurse Trimaya Cahya Mulat, Eskep MM MKes, selaku Ketua 2 dari Asosiasi Institusi Pendidikan Vokasi Keperawatan Pusat untuk memberikan kata sambutan. Kepada Bapak Trimaya Cahya Mulat, dipersilahkan.
Assalamualaikum warahmatullahi wabarakatuh. Om Swastiastu, Namo Buddhaya. Selamat pagi, salam sejahtera buat kita semua. Yang terhormat Bapak Arif Fadilah, Ketua PBNI Pusat, yang terhormat Direktur Akper Pelni, Direktur Akper Fatmawati, Direktur Kris Wisada, Akper Pasar Rebo, dan Akper PGI Cikini. Welcome from Professor Yusin Sujing, Cheng Kung University, Taiwan, Professor Dioso from Lincoln University, Malaysia, Mr. Wantonoro, PhD, University Asia, Indonesia, Mrs. Dr. Rani Amdal, PhD, CRM College of Nursing, India. First of all, on anthology from the General Chairman, who was contributing to Archbishops to the unfulfilled interest of the service. First of all, let us praise and thank the praise of Allah Almighty for the abuse of the grace, the joy of in all of us can together in this place without any barriers at all and in good health. Not forgetting the salawat and greeting we found out to the prompts Muhammad Bo has brought us out of the list, again to the array of bright like today. Hadirin yang saya hormati, kegiatan seminar internasional ini sangat bermanfaat bagi peserta. Selain biayanya yang sangat murah, ya, efektif dan sangat efisien, apalagi di saat musim pandemik seperti sekarang ini. IFVG mengucapkan terima kasih banyak atas inisiatif yang dilaksanakan oleh institusi asosiasi vokasi ini, terutama kepada Akper Pelni, Akper Fatmawati, Akper Krisusada, Akper Pasar Rebo, Akper PGI Cikidi. Semoga ini semua bisa menjadi barometer untuk seluruh pendidikan di Indonesia, terutama pendidikan vokasi yang saat ini memang menjadi tumpuan pemerintah yang ke depan akan menjadi tolok ukur yang memang sangat dibutuhkan di pemerintahan kita. Seperti pada reformasi penyelenggaraan pendidikan yang sekarang ini, ini memang pendidikan vokasi dikembangkan, ya, mulai bagaimana penguatan pembelajaran inovatif yang seperti saat ini memang sebagai pengejawantahan yang memang dilaksanakan, sehingga dengan seminar internasional secara daring ini menjadi menambah khasanah, ya, untuk penguatan pembelajaran kita. Yang kedua, penyelarasan kurikulum, ya, dan penyelarasan kurikulum dan pembelajaran ini, dan penguatan pelaksanaan pendidikan vokasi ini menjadi penerapan teaching program dalam pembelajaran kita, sehingga dalam peningkatan kerjasama, ya, kita bisa, sehingga tidak dimungkinkan bahwa di regional bisa bersama-sama, ya. Kalau memang di dalam institusi untuk pelaksanaan kegiatan seni sudah tidak mampu, kita bisa join institusinya seperti yang dilaksanakan sekarang ini dengan 5 bersatu untuk menyelenggarakan seminar yang saat ini dibutuhkan oleh anggota-anggota kita, ya, terutama teman-teman kita yang saat ini yang berdampak, ya, yang tidak bisa menghadiri, ya, sehingga dengan di kantor, di rumah kita bisa melaksanakan kegiatan dengan baik. Nah, apa yang harus kita lakukan di sekarang ini, bahwa seminar ini dapat bermanfaat, ya, dalam memberikan informasi, ya, sebagai program yang memang program yang menjadi data yang ada di institusi pendidikan kita, ya, terutama di penelitian, ya, di penelitian pengembangan, ya, sehingga ini semua sangat bermanfaat buat anggota kita, ya. Terima kasih kepada seluruh panitia, ya, yang sudah dapat menyelenggarakan kegiatan seminar internasional ini dengan judul Medical Research Nursing Adaptation in Pandemic COVID-19. Selamat, sesekali ucapkan Asosiasi Institusi Pendidikan Vokasi Kepulauan Indonesia mengucapkan selamat kepada 5 institusi ini yang sudah melaksanakan kegiatan dengan maksimal, ya, sehingga pada hari ini sudah dapat dilaksanakan dengan baik. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh. Terima kasih.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you to Mr. Trimaya. The next welcoming speech, and as always, opening this conference, which will be delivered by Chief of the Committee of this international conference. Please welcome to Nurse Sri Hunun Widyastuti, MCAP SPKEP J.
Selanjutnya kami undang Ketua Seminar Internasional kita, yaitu Nurse Sri Hunun Widyastuti, MCAP SPKEP J, untuk memberikan kata sambutan sekaligus membuka acara ini. Kepada Nurse Sri Hunun dipersilahkan.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, Om Swastiastu, Namo Buddhaya, salam kebajikan. The honorable participant of international conference in our Zoom room, and our YouTube channel. Good morning, and we hope that you all in the good health condition. Praise the Lord, the Almighty God, for blessing us to hold international conference with the theme Adaptation Medical Surgical Nursing in Pandemic COVID-19. The purpose of this conference is to equip a nurse so they can give an excellent caring, especially in medical surgical field. This conference can be held with the cooperation of 5 nursing academy institutions, also 4 speakers from 4 countries, Indonesia, Taiwan, Malaysia, India, and continued with oral presentation from 7 lectures based on results of what they have researched. The conference participants consist of college students, lecturers, college leaders, and public who is in webinar or streaming in YouTube channel. I would like to welcome and thank you to the extraordinary speaker from Taiwan, Professor Su Yingfang, from Malaysia, Professor Rigider Dr. Tioso, from India, Dr. Kanyamal, and from Indonesia, Dr. Wantonoro. Welcome and thanks to the Chief of Indonesia National Nurses Association, Mr. Harif Fadilah, Master in Nursing, Master of Law, and great gratitude the Chief of Education Institution, Association Vocation, Diplomatry Indonesia, such as Public Health which is represented by Dr. Trimaya Cahyamula, and the Head of Regional 3, Mrs. Silvana Evelinda, Master in Nursing, those who responsible to these 5 institutions. Welcome and great thanks also to the 5 directors of Nursing Academy, Nurse Swarsa Dewi, Nurse Buntar Handayani, Nurse Iga Dewi, Nurse Yeni, and Nurse Tati Stiarini as well. Welcome and thanks to all invited honorable audience. Special thanks to the World Committee who have helped to hold this conference activity virtual for this first time. Hopefully everything goes successfully. In the name of the Almighty God, we believe this conference will be useful. At least, but not least, in the name of the committee, I would like to ask for your forgiveness suppose any mistake during the activity dance. Thank you and God bless us. So, International Conference 2020 with the topic Adaptation Medical Surgical Nursing in Pandemic COVID-19 is officially started.
Thank you to Nurse Rihunun. Let's have a moment of silence before we start the conference. Let me invite Mr. Cecep Kusnadi Eskep to lead us to pray. To Mr. Cecep, time is yours.
Sebelum memasuki acara utama kita pada hari ini, marilah kita berdoa menurut agama dan kepercayaan kita masing-masing. Doa akan dipimpin oleh Bapak Cecep Kusnadi Eskep. Kepada Bapak Cecep Kusnadi, dipersilahkan.
Assalamualaikum warahmatullahi wabarakatuh. Izinkan saya memimpin doa dengan cara Islam. Bapak, Ibu, hadirin sekalian, mohon berkenan untuk menyesuaikan sesuai dengan agama dan keyakinan masing-masing. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. hamdan syakirin, hamdan na'imin, hamdan yu'afi ni'mahu wa yukafi majidah. Ya Rabbana lakal hamdu kama yanbaghi lil zalali wajhikal karim wa azimi sultani. Asyhadu an la ilaha illallah wa asyhadu anna Muhammadar Rasulullah. Allahumma sholli wa sallim ala Sayyidina Muhammadin wa ala alihi wa sahbihi ajmain. Ya Allah, ya Tuhan kami, segala puji untukmu pemelihara alam semesta. Segala puji atas karunia dan kenikmatan yang Engkau limpahkan kepada kami. Segala puji atas keagunganmu, segala puji atas kemuliaanmu dan kekuasaanmu. Ya Malik, ya Kudus, kami agungkan namamu karena hanya Engkaulah Tuhan kami. Hanya kepadamu kami bersujud, hanya kepadamu kami bersyukur, dan hanya kepadamu kami memanjatkan doa. Ya Rabbana, ya Rahim, hanya kepadamu kami menyembah, dan hanya kepadamu kami memohon pertolongan. Ya Rabbana, hari ini kami berkumpul dalam acara Zuminar Internasional Keperawatan untuk berdiskusi, mengurai pikir, untuk memberikan sumbangsih terbaik di bidang kesehatan, khususnya ilmu keperawatan bagi bangsa dan negeri tercinta ini. Karena itu, ya Allah, lancarkanlah acara kami, berkahilah, penuhilah pertemuan ini dengan kebaikan dari awal hingga akhir nanti. Bukakanlah pikiran kami, lenturkanlah lidah kami, dan berikanlah kepada kami ide-ide cemerlang untuk membangun bangsa dan negeri ini melalui ilmu keperawatan. Ya Allah yang maha mengetahui yang gaib, bimbingkanlah kami dengan hidayah-Mu, berkahilah kami selalu dengan takdir-Mu, dan jadikanlah hati kami selalu ridho dengan pemberian-Mu. Rabbi sohri sodri, wa yasirli amri, wahlul uqdata min lisani yafqahu qawli. Allahumma arinal haqqo haqqo warzuqna tiba'ah, wa arinal batila batila warzuqna tinabah. Ya Allah, tunjukkanlah kepada kami bahwa yang benar adalah benar, dan berikanlah kepada kami kekuatan dan kemampuan untuk menjalankannya, serta tunjukkanlah bahwa yang salah adalah salah, dan berikanlah kepada kami kekuatan dan kemampuan untuk meninggalkannya. Rabbana atina fid dunya hasanah, wa fil akhirati hasanah, wa qina azabannar. Subhanaka rabbika rabbil izzati amma yasifun, wassalamu mursalin, walhamdulillahi rabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you to Mr. Cecep. And now, ladies and gentlemen, let's move to the main agenda. We are going to have our conference session. I kindly invite our moderator today, Nurse Samsinar Butar-Butar Eskep. To Nurse Samsinar, I hand over this agenda to you.
Para hadirin sekalian, sekarang kita akan masuk ke acara utama kita, yaitu seminar sesi pertama, yang akan dipimpin oleh moderator Nurse Samsinar Butar-Butar Eskep. Kepada Nurse Samsinar, dipersilahkan.
Thank you to the Master Ceremony and committee who have gave me the opportunity to lead this event as a moderator today. I feel honored to be your moderator. My name is Samsinar. I am from Nursing Academy of Cikini. As the MC explained before that we have 4 speakers today. They are from Taiwan, Malaysia, India, and Indonesia. I'm going to present the first speaker who will give the presentation, a speaker from Taiwan. She is Professor Swing Fang, RN, PhD from Changkung University, Taiwan. Her topic today is Cancer Survivors Care during the COVID-19 pandemic in Taiwan. Let me read the CV of hers. She graduated with Bachelor of Science at National Chung Kung University, Taiwan on 1994, Master of Science at National Taiwan University on 1999, PhD from Institute of Allied Health Science at National Cheng Kung University, Taiwan on 2010. Experience background: in the last 26 years, she has worked as a registered nurse at Cheng Kung Memorial Hospital, after that at Tzu College of Technology, after that as a lecturer and assistant professor at Changhua University of Medical Technology, and the last one, she has worked as assistant professor at Cheng Kung University. She has 31 publications, 36 conference papers, and 5 other publications. To all participants, again, I remind you you are allowed to give a question on the chat room while the speaker is presenting the material. Please write down your name, from which nursing academy or institution that you are come from, and to whom that questions belongs to. Professor Suying Fang, are you with us now? Hello.
Yes.
Hi.
Yes. Hello, Professor Suying Fang. I gave you 40 minutes to deliver your speech, includes the discussion session. To
Okay.
Professor Suying Fang, time is yours.
Thank you.
Welcome.
I will share my slide.
Yes, ma'am.
So I need to go back in the beginning. Now you
And we back.
Do you need my help to display your PowerPoint?
do you see the slide?
Anyone see the slides?
No, we can't see.
Okay, wait. Maybe just.
Orang si Rizky udah nggak ada foto pernikahan.
Anyone see our slides?
Wait. We can see.
Okay, good. Perfect.
Good morning. Good morning, everybody. And good morning for the trip of the Indonesian National Nurse Association and the trip of the Indonesia National Diploma Nurse Association. Thank you for your invitation, and thank you for the moderator to introduce me. And it's my pleasure to give the speech in this webinar international conference. Okay, this is about my research specialty. My research focus on the breast cancer survival and related to the wound care. And previously, I focused on the care need, unmet need of the breast cancer survival. So I developed the modified cancer survival unmet need scale to use in Taiwan. In another area, I also interested in the body image of the breast cancer women. So I also explore some issue related to the role of the partner on women's experience during the process of breast cancer illness trajectory. In addition, recently, I also developed a e-based survivorship care plan and the decision aid for the women to make the surgery decision. So I think because I'm interested in the study related to the cancer survival, so I would like to share some issue about the cancer survival care during the COVID-19 pandemic. So since the late December 2019, COVID-19 has resulted in an ongoing pandemic of viral pneumonia, which started in, everybody know, in the China of the Wuhan city. At the time of preparing this speech, global incidence passes more than 20 million, with more than 700,000 fatalities. So what's the impact on cancer survival? Okay. Actually, I know that everybody can know that people with compromised immune system are at increased risk for COVID-19. But how about the cancer patient? We know cancer patient may receive the chemotherapy, radiotherapy. Some patients may receive the bone marrow transplantation, like the leukemia or multiple myeloma. Or there are some new therapy like immunotherapy, antibody treatment for cancer. So people, this treatment all may influence cancer patients' immune system. So people affected by cancer could be at elevated risk of severe COVID-19 disease. So according to the National Cancer Institute, there are more than 50 million people have cancer and minimal cancer survival. So let's look into some statistics for the prevalence of cancer with COVID-19. One study conducted in China by Liang. His study conducted in early COVID-19 period. The findings suggest a cancer prevalence of 1% among the 1,590 patient case of COVID-19. In his study, he also found that patients with cancer had a higher risk of severe events. What the severe events means? It means that patient admitted to ICU and required a ventilator to support their respiration or died because of the COVID-19. And compared to without cancer, yes, the patient have severe events is 39% for cancer patient and 8% for the non-cancer patient. So it's significant. The hazard ratio is significant. In another study, a further study, the author include more than 70,000 patients, also conducted in China, and they found that a fatality rate is 5 to 6% among those affected by cancer. So because the two study is individual study, so in the recent, one study conducted by I think in the UK, they used the meta-analysis to organize the individual study to know the prevalence of cancer in patients with COVID-19. And in this study, they found that the prevalence of cancer suffer COVID-19 is 2%, 2%, because the I-square is a little higher. So they use the subgroup analysis based on their sample size. So when the sample size less than 100, the prevalence was slightly higher, around 3%. But with a sample size over 100, a lower overall prevalence of 2%. So in summary, patients with cancer or cancer survival remain an important at-risk population for COVID-19. So we can know that the recent COVID-19 pandemic indeed affect the world and has the potentially to disproportionately affect and disrupt the life of cancer survival. No matter what kind of survival stage, complete treatment or undergoing treatment, or they live longer with cancer. We know that cancer survival had a late and long-term effect, even they complete all treatment. So cancer patients face a variety of difficulties and challenge due to that they still need to living with the late and the long-term effect. So what the late long-term effect is including physical and psychological symptoms, pain, lymphoedema, osteoporosis, depression, anxiety, and other kind of interpersonal employment or financial strain. So all of these symptoms may impact their quality of life. So during the period, they still need to call for help from the medical research to resolve this problem. So we know that during the pandemic period, we need to follow some recommendation to decrease the risk of getting infection. Everybody know that we need to have the physical distancing. We need to washing hand. We need to avoid touching each other. However, there is no evidence to suggest that different precautions should be recommended for cancer survival compared to the general population. So at this time, cancer survival should adhere to general protocol available through the community. So what's the recommendation maybe impact on cancer survival? The first, this recommendation may raise fear related to the survival's prior traumatic health experience. Everybody know that during the treatment, such as chemo, some people may have the neutropenia, so they need to isolation, they need to hospital, they need to live in the hospital for a long time and be isolated. So they may have some a bad experience. If during the pandemic, they need to go back to experience that kind of a bad experience. So this is the first raise their fear. The second one is social distancing and the physical distancing. This may present particular challenge for survival to contact and interact, because survival sometimes need to have some social support to relieve their psychological depression symptom. So during these pandemics, because of social distancing, they need to shutting down of in-person support group, avoiding large group gathering in place of worship and other community organization, and distancing their family and the social circles. So they will decrease their social support system. The third one, they may have more stress because stress related to the pandemic may exacerbate other treatment-related effects, including maybe they induce their cognitive problems such as memory loss or slowing of information process and the problem solving. In addition, the COVID-19 driven closure of non-essential service and the redirection of healthcare may also increase anxiety and confusion. Survivors who are receiving ongoing cancer treatment may struggle with tough decision whether they need to go to the hospital, because they worry about if they go to hospital, they will have the risk to infected with COVID-19 in clinical facility. In other, survival may also be at particular risk for financial impact related to COVID-19, because you know that a lot of cancer survivors maybe go back to their normal life. They still have their work. However, during the pandemic, they need to weigh the benefit. They need to trade off the benefit of work with potential in risk exposure depending on the occupational risk. Because if they go outside to work, they also need to contact with some people, so they also increasing their risk of the COVID-19. So let's see a study to understand the psychological distress during COVID-19. The study is conducted in Hong Kong and in the early period of the pandemic. So the study want to understand the psychological distress during the 2019 COVID-19 disease pandemic among cancer survivors, and they use the healthy to be their control. But from the study, they found that about 1/8 reported borderline to clinical level of anxiety in both samples, and about 1/7 cancer survivor and 1/9 healthy control reported borderline to clinical level of depressive symptom. And compared with the healthy control, cancer survivor reported less distress during the pandemic. So although this study did not find any significant increased level compared to healthy control, but the sample size is need to be cautioned, because only have 72 cancer survivor in this study, and the study only conducted in the early period of the pandemics. So I also found another study, and this study just published in the July, in early of the July, and the study focused on the impact of COVID-19 on adolescent and young adult cancer care and their well-being. This study conducted in the UK, and the design is used the cross-sectional survey, and the participant is a cancer patient or survivor aged between 18 to 39 years, diagnosis with any kind of cancer at their children at age later. Totally 177 individuals included in study, and the purpose is want to understand the impact of COVID-19 on their cancer care and the psychological well-being, and they also hope to know their information need related to the COVID-19. So this is the result, and we can from the result that the highest level of anxiety in those who have complete treatment within the past 6 months, and followed by those in treatment at time of the study. And the author suspect maybe 2 reasons can increase their anxiety. The first one is because the uncertainty often experienced when they just complete their treatments, because individuals often have to wait for their testing before remission can be confirmed. So this treatment transition can be burdensome for this patient. The other reason is that the first few months after treatment are also need to frequent follow up going to the hospital outpatient visit. So because COVID-19 pandemics, sometimes they worry that whether their outpatient visit need to be postponed or canceled during the pandemics. So all of these reasons can added uncertainty, so make their anxiety increase. So in the right-hand table, what their anxiety compared to the COVID-19 pandemic, and we can know that no matter what survival stage, the cancer survival all feel that more anxious than before. So we can see the percentage or over than 50%. So the study also used qualitative study to interview the participant, and they organized their interview into the category, and we can know that the participant feel anxiety. Maybe not focus on their health. They also have some general anxiety, and then they feel loneliness during the pandemic. They fear their mood is not bad, it's not good, and they sometimes feel they will dying, and they worry about COVID-19 themselves. They also worry about COVID-19 others for their family or their friend. They worry about their cancer care. They worry about whether they can come back to their normal life, and they worry about their finance. So actually, the cancer survival during the period have a lot of anxiety. So what the information need by this survival, and we can see the result from the table, and know that no matter what the survival stage, whether they undergoing treatment or complete treatment or complete their treatment more than 6 months, they all hope healthcare provider can provide more information related to the COVID-19 information. And we can see the percentage is all more than 50%. So what the strategy for caring cancer survival? And I found a study from the Multinational Association Supportive Care in Cancer. This is the international association that focuses on the cancer survivorship. And they also conduct a study that hope to provide some recommendation to help the national to provide the care for the cancer survival. And the study conducted from April 22 to 29 this year. And they invited participants, totally 38 members. The member including physician, nurse, dentist, and clinical research, and radiographer and pharmacist. And the data collection from different countries, different area, including Asian Pacific, such as Australia, India, Singapore, and from the Europe, Italy, Portugal, the Netherlands, and the UK. Also from the North American, such as Canada, Mexico, and the USA, and the South American, such as Brazil. So they just do some survey, what the impact from the COVID-19 and what their facility to resolve the cancer care problem. So from the study revealed that the post-treatment follow-up care for cancer survival has dramatic change as a result of COVID-19, including the first one is the survival had to delay a cancer follow-up appointment for patient unless urgent care was required. The second one is some services have redirected cancer survival to large facilities, such as government hospital, as they had insufficient capacity to respond to cancer survival need. And the third one is some hospital replace all face-to-face appointment with telehealth. Maybe they need to use the telephone or video conferencing through digital platform. So there are some issue raised because the cancer survival care have a little challenge. So the bigger issue is that using telehealth. So using telehealth may be an alternative way to provide cancer survival care. However, there are some barriers need to be resolved. So according to the association, can organize 3 types of barrier when using the telehealth. The first one is system barrier, because we need to consider the area whether they have the limited access to technology. Another issue is the policy issue, because using telehealth, can we have the reimbursement, or we have the funding to provide the telehealth? And the issue may be raised due to that using internet may have some safety or privacy concern. The second one is patient barrier. You know that a lot of patients would like to use the face-to-face appointment with the physician, because using the face-to-face communication, they think that they can directly communicate their problem more effectively. However, using the telehealth maybe increase their risk. Maybe the risk of anxiety and distress, maybe they do not have ability to use the telehealth, or maybe they do not, they will feel anxiety when they just see the video, or just only use the voice. They think that may increase their anxiety. They cannot effectively communicate their symptom or their problem. So this is the patient barrier. The third one is physician barrier. Sometimes maybe physician or clinician cannot accept the telehealth. We still need to increase their acceptability and the skill when using telehealth to improve the quality of care. So the association provide the 3 priority area to survivorship care. The first one is they recommend maybe we can try age of immediate need of cancer survival. What this means, it means that maybe we first need to screen for survival's need, whether they need to go to the hospital to face-to-face appointment, or some kind of survival's need can be used telehealth. So maybe we can have some screening tool to help us to know the survivor's need and try to prioritization of their care. However, this care still need to contextualize approach consistent with the local setting and the resource. The second issue is just I tell the telehealth the survivorship care. So for the telehealth survivorship care, the first one we need to guidance on identification of patient who should suitable for tail survivorship follow-up. And we also need to consider training practitioner, training patient, and the training caregiver. And some barrier, I just talking about the 3 kind of barrier. So we need to overcome the barrier at the clinical, at the organization, and the system level, such as funding or reimbursement arrangement. We need to think about that issue. The third one is because telehealth survivorship care has using the internet, we just worry about some privacy issue can be influenced. So some ethical and cultural consideration need to be think about what's the appropriate regulation we need to develop to especially the more safety environment to use the tail survivorship care. So the third one is how about the alternative model of care for the survivorship? Who should be deliver survivorship, and which model of care are most effective in delivering quality of care? So this is the recommendation from the MASCC Association. So the challenge in cancer survival in the future, until now that the study I share with all of you that the care need only focus on the younger adult. So we still need to think about the care need for elder cancer survival during the pandemic. And the care need we share will only focus on the short period, the shortest survival stage of the cancer survival. So we need to think about the care need for long-term survival. And we need to think about the care need for the diversity, racial, and ethnic cancer survival group. And because using the internet may be alternative care for the cancer survival. However, we still need to know the effect of using the internet-based survivorship care during the COVID-19 pandemic. So in the future, we still need to use the rigorous research to evaluate the effect of telehealth. And we know that because using the telehealth cannot have the element of the temperature, because you know that some we provided care face-to-face have more humanness. So we need to think about how to deliver the care with using the telehealth still have the humanness to support the survival, to help them
can have a quality of interaction with them. And the other in other hand, that we need to think about the role of nurse in the telehealth. What's the role when we provide the cancer survival care? What the role of the nurse during the pandemic? So unlike system to determine patient need regularly, maybe we can think about how to provide this kind of role and how to deliver cancer care at home. This is another kind of issue that nurses need to consider. So today, a number of organizations have provided a cancer survivorship community. This is the website that I want to just share with you. Maybe you can go to the website or see some information about how to care the cancer survival for you and for the cancer patient. So I show you the website. So can you see the resource? They have some organization information that patient may face during the pandemic. So maybe we can somehow, maybe you can translate into the different language and help your cancer survival to know more about the information, how to care by themselves and other. Another is, I think it's very interesting because when cancer survival need to stay at their home, so what the exercise they can do. So this is the video that I think we can suggest the survival to practice at their home.
Welcome to Exercising at Home, a video program designed to get you moving regardless of where you're at. Today, we will be focusing on strength and cardio with my friend Tanya. Let's get started. We're going to start with a warm-up.
This website,
and we're going to do each
just cancer survival can follow the exercise step. So and this exercise lasts for 25 minutes. So maybe we can recommend our patient to use this kind of information to make them live healthier.
We're about halfway through this march, so let's add in our arms and get them going forwards and backwards. Just going in. Great job. You should hopefully start to feel your heart rate pick up a little bit as you're moving. You got 15 seconds left, and then we're going to move into our next movement. 10 seconds. 5 seconds, and then we're going to move to a side step. And go to side step. There you go. Step together, step together.
And close.
Great job.
Or just stop there.
Again, we're keeping this movement going for a minute.
Okay, and we go back to the.
Okay, we go back our slide.
And then
okay. Okay. So I think this information is useful for cancer survival. So maybe you can choose which one is appropriate for your patient. And finally, the COVID-19 pandemic is rapidly evolving and we learn new detail every day.
So even though the disruption in our daily routine and the healthcare system pose many challenges, there are many opportunities for improvement of cancer survival care in the future. So that's all. Thank you for your attention.
Thank you for giving a nice presentation, ma'am. Well, now we are going to the discussion session. We have more questions here. I need you to answer for a while. I just want to read one by one. The first one is, the question came from Novia Destavinati from Nursing Academy of Cikini. She's asking, I want to ask to Professor Suying Fang, what is the best method we can use for cancer patients to undergo chemotherapy, whether to stay at home without chemotherapy or stay in the hospital for chemotherapy with all the risks maybe that may occur. Because many cases their cancer worsen because they are afraid to go to the hospital for chemotherapy because they are afraid of COVID-19. Your answer, please, ma'am.
Okay. I know that this is a very because it's a difficult decision to for patient to decide whether they go to the hospital to receive the chemotherapy. However, you know, because now there is no standard, there is no evidence to support whether they can delay for chemotherapy or not. So in Taiwan, I share the experience in Taiwan. In our hospital or in our country, we still hope that if the patient still undergoing their chemotherapy, they need to follow the schedule of their chemotherapy. If they do not have a complication after their each regimen, you know, if they do not have neutropenia, their immunocompromised immune system is good, so they still need to go for the chemotherapy. But I need to say that in the international or WHO, there is no consensus to provide a recommendation whether they stay at home and do not go for the chemotherapy. I think they still do the research to validate the evidence.
Okay, thank you, ma'am, for the answer. The second question came from Sarah from Nursing Academy of Cikini. Do you have any difficulties while adapting barrier using telehealth in your country?
You mean telehealth in my country?
Yes, ma'am.
Actually, because I introduced myself, I developed a website for the cancer survivorship. This website provides a lot of information that they can use the information to manage their symptoms. Sometimes, so if they do not have a big problem, not urgent problem, they can just see how to manage their symptom at home. However, if they have a severe problem, we still just recommend the patient to go to the outpatient visit. However, they need to protect themselves very carefully, and they still need to go to the hospital. So telehealth, actually in Taiwan, no, because in our country, I think our country, the COVID-19 problem is not very severe. So the patients still go to the outpatient face-to-face appointment.
Nice answer, ma'am. The third question, ma'am, came from Andrea, nursing student from Cikini. Mr. Wang, Mrs. Wang, according to our body system, which type of cancer are more deadly and fatal during this pandemic? So she's asking what kind of cancer?
What kind of cancer?
Yes. Which cancer? It is maybe there is.
Yes.
Yes.
So what
will,
kind
will be
what?
will be fatal in the COVID-19. Will be dangerous in the COVID-19.
Okay. No, I don't have any. I don't have searched any study that talking about which type of cancer can be dangerous for the COVID-19. However, I think it's important is that I see one article talking about maybe lung cancer, because lung cancer have you know that and the COVID-19 will result in the pneumonia if the lung cancer have lower ventilation function. So maybe if they got the COVID-19, they will decrease their, yeah.
Yes, thank you. That is that. So the lung cancer is more deadly.
Yeah.
Yes, ma'am. Thank you.
Until now, there is no evidence to suppose, because
yes.
you know that the study still collected. So until now, I do not see any reference to analyze this kind of information.
Meaning to say there is no research yet to prove that.
Yes, maybe recently we can have some article talking about that.
I got it, ma'am. The second, the last question maybe came from Ricky Rianto, a son from Pelni Nursing Academy. He is asking, what is the best way we can use for cancer patient to undergo chemotherapy during the COVID pandemic?
I think this is similar to the first question. Yes, so maybe I have answered that question.
Sama seperti yang sudah dijawab ya. Jadi kalau memang mereka perlu ke rumah sakit, selalu akan dijadwalkan, kecuali kasus-kasus yang harus. We have another question, ma'am. How to deliver cancer care at home, which is we know that take care of cancer patient is very special condition.
How to deliver care at home, Professor?
How to care patient at home for what kind of patient? Undergoing treatment or no matter what kind of?
This deliver care patient for cancer, but they did not tell the kind of the cancer.
So at home, I think the use
any
the
cancer.
Yeah, I think because when cancer complete their active treatment, they will have I mean that they do not need to go to the outpatient visit frequently. Maybe first maybe every 3 months, and then 6 months, and then 1 year to go back to the outpatient clinic to follow up. So because I just show you that I developed a website. The website is focused on the survivorship care plan. So I think if we can develop rigor and the website organize the information that fit into their need. So if they have problem, they can just go to the website to see the information to manage their problem first. So sometimes because in Taiwan we have the cancer care manager. So if they have urgent problem, maybe they can use the line to ask the case manager. So whether they need to go to the outpatient visit or whether they need to go to the emergency care. So I think it's a good way just to use the internet information and combine with the cancer care manager.
Thank you, ma'am. Kindly, maybe you can answer another last question.
Okay, no problem.
came from Nursing Academy of Pelni, Dewi Astuti, sorry. I want to ask Professor, are there any risk factor for COVID-19 in cancer patient? You told that before.
Immune system
Immune
is lower, will have higher risk for COVID-19.
Okay. Thank you, ma'am. Thank you for the nice explanations. I saw here Nurse Ramita want to ask directly, is it allowed? Maybe we can keep it with the chat room. Mr. Nurse Ramita, we will just keep your question, please, because we finish our time today. Thank you, ma'am, for the extraordinary presentation, and thank you for the answering those questions. I will give some conclusion today about your topic. You told us on your slide that people with compromised immune system are at increased risk for COVID-19. Some problem that found in Taiwan that the treatment with cancer had to delay an appointment for patient unless urgent care. The second is some services has redirected cancer survivor to a larger facilities. And the third one is to replace all face-to-face appointment with telehealth. And the other one is also cancer patient is looking for the information about COVID-19 stratified by treatment phase, even they are in the undergoing treatment, complete treatment within 6 months or more than 6 months. So we are as a nurse, we need to taking care of them more carefully.
Yes.
That's all my conclusion about this topic.
Great, perfect.
Thank you again to Professor Suying Fang.
Thank you.
PhD. Hopefully, in the future, we will have another occasion and another event. Of course, we can share knowledge and experience. Thank you again, Professor Swing Fang, RN PhD. Thank you.
Thank you. Thank you.
Okay. The next speaker, the second speaker is from Malaysia. He is Associate Professor Regidor III Diuso, RN MSc PhD. His topic today is excellent nursing services for patient chronic kidney disease on dialysis in the new normal era. Let me read the CV of him. He graduated with Bachelor of Science in Nursing at Trinity University of Asia, Philippines on 2000, post-basic certificate in teaching in methodology at Lincoln University College, Malaysia on 2012, Master on Science in Contemporary Healthcare at the University of Hertfordshire, UK on 2014, Doctor of Philosophy in Health Science at Lincoln University College, Malaysia on 2020. Experience background, in the last 20 years, he has worked as a teacher at the National Center for Mental Health, Philippine General Hospital, Lincoln University, and he has 32 publications in total, along with 3 academic volunteers. To Associate Professor the third Diuso RN PhD, I gave you 30 minutes to deliver your speech. To Professor, time is yours.
Thank you, Ms. Samsinar. I'm very humbled and very privileged to be here.
Yes, sir.
I would like to share the screen. All right, the title of my presentation for today is Excellent Nursing Services for Patients with Dialysis in the New Normal Era. So the introduction, the focus of this study is on the nursing service and the government and public dialysis centers in Peninsular Malaysia are vigilant in curtailing the spread of coronavirus 19 as a pandemic. The pandemic coronavirus 19 has potential carriers which needs to be watched out for by the nursing services, which are the aging population, 50 years old and above, frequent socialization or physical socialization, working and residing in the epidemic center of the outbreak, and patients with heart, liver, lungs, and kidney problems. So the objectives of the study is to determine the new normal for nursing services delivering dialysis and determine the impact of the new normal for nursing services to deliver dialysis. So as a background, this came from the World Health Organization 2020. The first wave of infection started on 24th January 2020 in Malaysia, and a total of 22 cases were identified, of which 12 had a travel history to affected countries and regions. And the second wave began on 27th February 2020, and it's still ongoing. So these are the number of cases per state. And Kuala Lumpur has the highest, Selangor, followed by Kuala Lumpur. And the rest are all enumerated here with a total of 105 new cases as of August 15, 2020. This is as of August 15, 2020, reported at the WHO for the 15th report. So the total cases is 9,175 cases of coronavirus 19. So let me define the terminologies that I will cite. First is the chronic kidney disease. I will mention chronic kidney disease, and this is the gradual loss of kidney function, and the kidneys filter wastes and excess fluids from our body, which are then excreted in the urine. While the systemic lupus erythematosus will also be mentioned in this presentation, this is an autoimmune disease, and in this disease, the immune system of the body mistakenly attacks healthy tissues. While the renal shutdown will also be mentioned, and it is a condition in which the kidneys stop working and are not able to remove waste and extra water from the blood or keep body chemicals in balance. And lastly, the diabetes mellitus is a condition that occurs when the body cannot use glucose or simple sugar normally. Another term that will be defined in this presentation is the new normal era in the dialysis setting, which is the physical distancing, avoiding direct hand contact, wearing personal protective equipment, using hand sanitizers, frequent hand washing with soap and clean water, disposing of wastes, and not recycling what has already been used, limiting 2 to 3 patients in a dialysis room where there are 20 bed capacities or 10 bed capacities, isolation of patients as much as possible. One of the conceptual framework looks at my variables. So this is the effect variable, which is the excellent nursing services, subdivided into further distinctive effect variables, while my cost variable is the dialysis patient, and the confounding variable is the potential COVID-19 carrier. So it's a confounding variable on dialysis patients who are potential for COVID-19 carrier. So the avoidance of direct hand contact, social distancing or physical distancing, use of personal protective equipments, laboratory testing to detect COVID-19, and isolation precautions. The design of this study, of this presentation, looks at K-series design. So this is K-series design, and it was implored as this study has no control over the outcome because only patients with certain manifestations of outcomes are sampled. And a statement of the external validity of the obtained data includes the patient characteristics will be discussed on each of the cases, and completeness of follow-up. The presence of chance and the blinding of results, direction, and magnitude of bias will also be acknowledged. The proposive sampling technique was used. So the sampling technique uses inclusion and exclusion criteria. The first inclusion is Malaysian patients. Definitely, the non-Malaysian patients will be excluded on selecting cases. Undergoing last stage of dialysis, and the exclusion criteria will be the the starting dialysis treatment. Those patients who are only starting for dialysis will be excluded, and patients dialyzed within Peninsular Malaysia are the only patient cases that is included in the study, and those who are dialyzed outside Peninsular Malaysia, such as in Sabah and in Sarawak, will be excluded. Good prognosis, negative on blood tests for COVID-19. So those who are negative on blood tests for COVID-19 are included in the case series, and those with poor prognosis will be excluded, such as organ dysfunction, multiple organ dysfunction, because dialysis has multiple organ dysfunctions. Date of occurrence of last dialysis is from June to August 2020. Date of occurrence that will be excluded in the case series will be the last dialysis that's before June 2020. Ethical consideration looks at confidentiality, respect of anonymity, so nobody will know who are the patients, and autonomy with written consents are obtained, beneficence by giving benefit for patients based on the findings, and by doing no harm, patients are not experimented, but only case studied with a case series. So let us see the findings. Number one. Case number one looks at chronic kidney disease as a comorbidity of alcohol abuse. So this is a case of a chronic kidney disease. The patient A, we will call him Mr. A. He's 56 years old and he's from Kuala Lumpur. He's a male patient and he's married with 2 grandchildren and of course with children as well, and the past medical history of renal failure for 10 years, which means to say he has been coming to dialysis center, to the hospital setting many times, and has been having a lot of physical socialization, and he's prone for acquiring or potential for transferring these COVID-19 cases, since he has grandchildren who always visits him, and he keeps on visiting the hospital for many times over, and he's working and residing at Kuala Lumpur, which is the highest number of COVID-19 cases. The sedentary lifestyle before dialysis is due to alcohol abuse. So going on bars, going on crowded places, limiting social distancing, these are the potential for transferring coronavirus 19. And knowing that the location of where the case, patient A, is coming from, working and residing at Kuala Lumpur, is a high risk for transferring the virus. So, what are the findings for this case? We are focusing on the nursing management. Therefore, one of the findings to determine the new normal of nursing service, we have to get the QR code. In Malaysia, it is a norm of getting the QR codes using handheld devices. It can be a tablet, it can be a handphones. So they have QR codes that they can use to scan and are done and hooked to a Wi-Fi to determine if patients came from places with a high rate of coronavirus 19. The impact of this new normal, patients feel breach of their confidentiality. So Mr. A, patient A, will feel breached of his confidentiality as their handphone numbers and their identities are exposed inside and outside the hospital setting. Well, this is one of the risks that the new normal will have in Malaysia, because they are trying to detect the patients who are high risk on transferring the infection, which is very effective since the rate is going down. The rate is flattening. Patients that came from places with high rate of coronavirus 19 cases were isolated in a room every session. So those who have high risk places such as the Kuala Lumpur, the case patient A is isolated. As you see, he's in a separate room and he's alone by himself. So what are the impact of that isolation? There's a fear of being alone in an isolated room. Patients are holistic human beings and they have emotions. So they are afraid of being isolated in a room for 4 hours. The dialysis is happening for 4 to 6 hours in a maximum of 6 hours if it's necessary, as it deems necessary. And they are alone there and they cannot be disturbed. So they have the fear of being alone. And the third one is the patient still needs to undergo the 5 to 6 hour session even without socialization, physical contact. Anxiety of the long hour session is one of the impact of this new normal in dialysis center. So anxiety can increase without socialization. So there's a nursing diagnosis of fear and a nursing diagnosis of anxiety of the long hour sessions without socialization. And patients are not recommended to open doors if they are isolated because they are positive on COVID-19. So this develops phobia. It will be developing phobia in the long run for patient A, since he's always in closed spaces and dialysis happens for a long period of time. Therefore, there is no possible way for patient A to leave for 6 hours in a closed space. So this is one of the impact that causes patient A of the new normal. Blood tests are done on COVID-19 every time patients are scheduled for dialysis. Definitely patient A must have blood tests for coronavirus 19 since he has been socializing over and over again. He has a lot of grandchildren. He's exposed to a very high risk place, which is Kuala Lumpur. And depression among patients is the impact of this new normal if they are found positive on coronavirus 19. Luckily, patient A is not positive with coronavirus 19. For the case number 2, patient B, systemic lupus erythematosus. SLE is also leading to kidney failure, definitely. They will undergo dialysis as well. And patient B is a 67-year-old male, so he's retired, just one of the aging population. 67 years old is old enough to be prone to acquiring coronavirus 19. He's male, divorced with 7 grandchildren. Definitely, if you have a lot of relatives visiting you more often, physical contacts are unavoidable and transfer of infection may occur. Past medical history of systemic lupus erythematosus and getting his regular yearly checkup at Kuala Lumpur is a high risk because the Kuala Lumpur is a major place of outbreak in Malaysia. And he's retired since he's 60 years old. He's always at home, but he's an aging, he's one of the geriatric patients. Definitely he's prone to acquiring or contracting coronavirus. And he's also residing in Kedah. So if he's residing in Kedah, Kedah is one of the high risks as well in Malaysia for coronavirus 19. Definitely, he's a prone for achieving and transferring the infection. So what are the new normal for nursing services for patient B? Number 1, patients are to wear personal protective equipment such as the masks. So patient B is asked to wear masks. Patients are to wear personal protective equipment such as masks. And this impacts him as having difficulty to breathe because SLE may also affect the lungs. And it is so difficult to breathe when wearing masks during dialysis because of his case. One of the second new normal is nurses are not supposed to touch patients. The impact of losing touch, physical contact with patients, the new normal of losing the physical contacts will suffer the effectiveness of touch therapy. As you can see, touch therapy is one of the nursing interventions for patients on dialysis to make them feel comfortable, to make them feel safe. And we have to limit that physical contact. So we cannot give him the touch. He's old and he feels alone knowing that he's divorced, so he wants somebody to touch him. But it is the new normal of not touching patients. Other healthcare providers are to wear personal protective equipment. As you can see, the nurses are wearing personal protective equipment. Rapport is harder to establish. This is the impact of wearing personal protective equipments from healthcare providers because they cannot be heard well since the mask is trying to is a barrier for a sound, a very clear sound, a vocal sound, which must be heard by the client effectively. And if the client is 67 years old, maybe patient B suffering from hearing, uh, a lesser hearing conduction. Therefore, you need to speak louder, and you will sound angry, and you will sound sometimes disrespectful because you're trying to scream or shout in a loud voice so that it can be heard clearly, and that will cause more anxiety to patient B since he's old and he needs the touch, but that is the new normal, and that is what impacts patients on dialysis. So case number 3 is patient C. Patient C has renal shutdown due to diabetes mellitus. Diabetes mellitus can also lead to renal shutdown. Definitely patient C, who is 49 years old and 9 months old, it's considered 50 because 3 months to go before he turns 50, although he's in the 49 years old. But it is on the way to old population or the aging population. 3 months to go before he reached 50, and he's a male patient. Definitely, he belongs to the aging population. Married with 5 sons, so who are still living with him in his house and are also working. So the 5 sons leaves the house, goes on physical contact and socialization with others in their working areas, and may transfer or may bring the virus. Who knows? They might be in physical contact with others, and they are prone to sending the virus to patient C. So that is one of the risk factors. The past medical history of diabetes mellitus type 2 for 11 years and regular getting insulin, visiting the hospital often for this, is also prone to acquiring coronavirus 19. And the last thing that is a risk factor is that he's working and residing in Petaling Jaya, Selangor. Petaling Jaya is one of the Selangor, specifically Selangor, the state of Selangor, is the second to Kuala Lumpur. So this is one of the highest risk in acquiring coronavirus 19. So findings for case number 3, patient C. The new normal for him is that patients are to bring their own entertainment devices. As you can see, he was watching his own device, he's reading his own device, because nobody can be with him. It has to be in a very long distance. And some of the impact that determines this is that some of the patients cannot afford entertainment devices. Luckily, patient C, which is Mr. C, can afford his own personal entertainment devices. So as you know, not all patients can afford it, especially those who are undergoing dialysis. And patient C is limited to a maximum of 3 in 10-bed dialysis rooms. So the patient waiting time for dialysis scheduling takes longer. So they have to wait longer until the 3rd one finishes. If they are early during their appointment, they have to wait until it is done. So sometimes they can be delayed because only 3 is allowed to enter in a 10. So you have to minus 7 from the 10, and the 7 will need to wait and be delayed for their schedule of dialysis. So patients are not allowed to socialize, specifically coming in close contact with others. Definitely, the impact here is they feel abandoned and they are alone. So those are the impacts for patient C. So he's like a loner in a dialysis setting. That is one of the impacts during the coronavirus 19 outbreak. So the discussion of this case, the strength of this design is a case series which is focused on each of cases, because not all cases are the same. It can be it can be generalized, but not all cases are the same. So that is the strength of this design. While the limitation is only within the setting of Malaysia, not appropriate to other countries who has lower incidences of coronavirus 19. And appropriate cases, one of the strengths as well is the appropriate cases were selected to achieve excellent nursing service, which means to say uh, they are appropriate according to the inclusion and exclusion criteria. None of them are positive with coronavirus 19 because that is one of the inclusion criteria. You have to be negative with coronavirus 19. While the limitations, the biases in selecting the cases appropriate only for the nursing management. So it's not more into nursing science, but excellent nursing service is nursing management. Therefore, we're trying to look at managing the dialysis center, not doing the dialysis itself, but only for the nursing management. So it's not a randomized case that we need to take. It's purposive sampling cases, which biases the selections of cases. It's non-randomized, which means to say I selected them personally and it's not randomized. The third strength of this case discussion is that it's generalizable for potential for carrying COVID-19, generalizable to nursing management. Anywhere you are, if you're a nurse manager, you have to consider aging population. And the comorbidities of COVID-19, the heart, the lungs, the liver, and other cases, other potential cases such as SLEs, immunocompromisations, those are the comorbidities of COVID-19. And with direct contact among visiting family members. Anybody who has visiting family members must be interviewed. Like, do you have children working outside your home, coming back to the houses? Those are the interviews that needs to be considered addressing COVID-19 physical contact and transferring or acquiring. And residing with high incidence of COVID-19. So nurse managers must see residences that is located within the high incidences of COVID-19 cases. However, there are limitations for these generalizability of the findings. The limitations are only 3 cases were used from 3 states in Malaysia, which is Kuala Lumpur, case number 1, Kedah, residing in Kedah, case number 2, and Selangor, case number 3. These are the top 3 states in Malaysia that are prone to increasing the outbreak of coronavirus 19. So as a conclusion, it is concluded that case series is an appropriate design for this topic for managing nursing management, excellent nursing services. And excellent nursing services for patients undergoing dialysis in the new normal era are, number 1, physical distancing, isolation precautions. You have to consider isolation precautions, longer waiting time for scheduling. You have to consider, you have to tell them that there are considerations of longer waiting time, avoiding direct hand contact, which is also a physical distancing, and which is addressing personal protective equipments, and frequent hand washing is advised. So you have to consider frequent hand washing. What is recommended to the general nursing education and research? Although it's focused on the nurse management, but it can be recommended to the general nursing education and research. It is recommended to focus on the chain of infection. When you teach students and when you do your research, or when you teach other nursing students, you focus on the chain of infection and how the chain of infection can transfer coronavirus 19. Emphasize on the frequent hand washing techniques. There are a lot of hand washing techniques that has been researched and studied, and it has to be emphasized on the nursing education and nursing research. Develop new ways on universal precautions for the new normal. So there are a lot of new ways. There are a lot of new normals ongoing nowadays. There are, depending on which location of the outbreak you have, the new normal depends on the outbreak. So maybe we can develop in research new ways on universal precautions for the new normal. And to the nursing management in dialysis setting, it is in the dialysis setting, the nursing management, it is recommended to analyze the location of the client's whereabouts on outbreak of coronavirus 19. Maybe it's not really that high risk. Some other places, some other locations are not high in coronavirus 19. So consider the client's whereabouts before you make your new normal. Consider holistic, body, mind, soul, spirit, and quality of life, because the human being are not just body, they are also in the mind, soul, and spirit approach when dealing with high-risk clients. It is recommended to the healthcare professionals in the dialysis setting, definitely for the doctors, for the phlebotomists, for the dialysis experts, for other nursing aides, or anywhere, utility workers who are healthcare professionals, they can collaborate with nursing management when considering preventive approach. Or they can devise new approach in curtailing the outbreak of coronavirus 19 because it depends on their dialysis setting. It doesn't mean that it can be generalized with all new normals to the entire world, since not all parts of dialysis centers have high risks in coronavirus 19. They can have device approach such as testing, blood testing. Some locations are doing throat swab or nasal swab. Some locations are doing one-shot drop tests of coronavirus 19 detection. So it depends on the new normal, and it depends on the outbreak of the location. If it is not too high risk, then they have lenient device approach in detecting, such as the QR codes, to see where is the location of the client's whereabouts. Maybe it can curtail the outbreak of coronavirus 19. So as for the references, these are the references. And thank you for your time listening.
Thank you, Mr. Regidor. I'm asking you to stay with us until the third and the fourth speaker is delivering their speech, please. Okay, we are going now to have the third speaker from Indonesia. He is Mr. Wantonoro, Master in Nursing and Specialist on Medical Surgical PhD. His topic today is Sharing Experience to the Nursing Clinical Practice in Indonesia. Let me read the CV of him. He graduated with Bachelor of Nursing at Asia Health Science Institute of Yogyakarta on 2008, Master of Nursing and Specialist Program at the University of Indonesia 2013 and 2014, PhD Nursing Program at Changgung University, Taiwan on 2019. And the experience background in the last 9 years, he has worked at the University Asia Yogyakarta as a lecturer and a preceptor. He has 9 publications in total. To Mr. Wantonoro, I gave you 30 minutes to deliver your speech. And to all the participants, you are allowed to submit your question on the chat room. To Mr. Wantonoro, time is yours.
Thank you so much. Okay, Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Good morning for General Chief of Nursing, Director, Committee, and all speaker and all participants in this very wonderful webinar. It is my honorable to be with you here to share my experience in this pandemic COVID-19 for our student in practical in medical surgical nursing. This is only my little experience, because this is not represent all Indonesian clinical practice in Indonesia, because I think every area, every university have different regulation and different in the nursing practice. So first of all, I need to point out my presentation today. This is my outline. I would like to tell about the nursing education. For the nursing education, I think for all participants in Indonesia, I think already know about the nursing education system in Indonesia. But I think we have different nursing education system in Taiwan, Malaysia, and India, maybe. And secondly, I will try to explain about the how to become a professional nurse in Indonesian National Nurse Association, and I would like to share about the nursing practice education, share my experience in the medical surgical nursing practice, and then finally I will talk about the challenge nursing education in this situation, in this unpredictable situation. And I hope I will finish my presentation in a short time. So this is the our regulation for national education system in Indonesia based on the, we call it with Undang-Undang Regulation number 20 in 2003. We have several types of education. For the first one is the vocational education and academic education, and the last one is professional education. For the level of education in Indonesia, we have the diploma program, and then we have the bachelor, magister, and doctoral program, and then we have some professional profession education. It is called it the specialist education in Indonesia. So how about the nursing in Indonesia, nursing education in Indonesia? Based on the Indonesian National Nurse Association, we have several kind of nursing level education in Indonesia. Well, the first one is diploma nursing program. This is about the 3-year academic and practice program. We need to have 3 years to finish this program. And then we have the bachelor program. This is called with nurse generalist. This is about the 5 years to finish this program, including in the academic for 4 years and the general clinical practice for 1 year. And then we have the magister nursing program. Is about the 2 or 3 years to finish this program. And also we have the doctoral program in the several university in Indonesia. It is about the in normal. It is about the 4 to 5 years if in to finish this program. So how to become a professional nurse based on our Indonesian National Nurse Association regulation? Actually, we need to graduate from nursing education, either from the diploma, from the bachelor or magister and the doctoral program. We need to graduate from the nursing education program. And then also we need to pass for national examination. We call it with Uji Kompetensi Nasional in Indonesia. We need to should be passed for this examination. After we have the graduation and the pass from national examination, we need to apply for a registration certification of nurse. We call it in Indonesia is Surat Tanda Registrasi Perawat. And after we get this kind of the certificate, so we will become the professional nurse in Indonesia. We can take care our patient in the hospital. So what is the professional nurse? So based on the concept analysis, I was found and I read this article, nursing professionalism in concept analysis. They have some attribute. For the first one is the body of knowledge. This is about the cognitive for the our student or our nurse. And then the secondly, we need to have some clinical skill or psychomotor. And then the last one, we need to have behavior, good attitude, good ethic, and we need to follow the standard for the our clinical practice. And the attribute, they have the some factor the some factor is about the education level, and then the training, clinical practice and experience, and also demographic culture. We will emphasize in the clinical practice for our student, because this is very important for us in this pandemic situation. So why the clinical practice in Indonesia in our profession is very important. You can imagine this one. You can see the picture. If you want to drive your car, you need to practice. Even though you read your book every day, but you never practice to drive your car, you cannot drive your car. And also, if you read your book every day about the swimming, but you never practice the swimming, you're not able to swim. This is same with our practice. If our student, if nurse only read a book but never practice, we cannot do the take care our patient in the clinical setting. So clinical practice is very important. And why clinical practice is important? Based on our regulation, health ministry and regulation, we need to have a nursing standard. In 2020, in this year, we have the standard profesi perawat. We call it the nursing standard for our education. Nursing skill, we need to have teach our student for nursing practice education. The student need to know, the student need to able to explain about something related with the practice in the nursing, and then able to demonstration for the something related with the nursing. This is kind of education in the university, in the classroom, or in the laboratorium. And then the student need to observe and able to do something related with nursing practice under supervision by the clinical instructor. And then the nurse student need to able to do something independently. This is kind of the clinical setting in the hospital and in the community setting. So we have to send our student to clinical practice in the hospital and the community setting. And then, based on the nursing caring theory, caring in the central expression of nursing, we know about that one. So caring in the central expression of nursing. This is kind of interpersonal process between two people with transpersonal dimension and the expression. So our student, our nurse need to have some human touch, and then the talking, smile with the our patient. So based on this theory, we need to send our student to a hospital to meet with our patient in the hospital. So based in this, I just mentioned before, nursing professionalism concept analysis and the nursing caring theory and health ministry regulation in Indonesia, and then Indonesian National Nurse Association regulation, we need to have some nursing practice education in the hospital and the community setting. It means we need to direct learning with our student, with our patient in the clinical setting, and then we need to have some preceptor and clinical setting in the hospital. This is kind of the learning method in the clinical setting we have in my university. For the first one is bedside teaching. This is kind of we teach our student in the side of the patient, and then we have pre and post conference, something like the discussion before and after we take care our patient, and then we have the case discussion and case presentation, and we have the learning method about the journal presentation for evidence-based practice in nursing. So the last one, we have the expert learning method. This is kind of the meet directly with the expert in the nursing field. So we need the clinical instructor and the preceptor. So nursing practice education is in the hospital and the clinical settings. And this is the evaluation method for clinical setting. We have the directly observed procedural skill, or we call it with easy with DOPS. And then we have the comprehensive clinical examination for our student. This is start from nursing care process, start from the assessment until the evaluation nursing care. And then we have the evaluation some of case report for our student. And this is several hospital we use to medical surgical nursing practice in our department. We have some several private hospital and then the government hospital. And how about the COVID-19? This is very difficult to say. Our nursing program made some difficult decision to remove students from the hospital in the clinical practice. But if the students were exposed to COVID-19 while in the clinical setting, they risk not only for their health, but their family and their friend, I think. So we already removed stop our student in the clinical practice because of the COVID-19, and then we do something the study from home, but based on the association in Indonesian Nursing Education Center, we need to have some the best time. We need to have some clinical practice after the pandemic is ends. So based on our experience in medical surgical nursing practice in we use technological learning, academic nursing have been quickly to modify in the light of the crisis caused by the COVID-19, and many have very quickly moved to online course delivery, including in my university. So for bedside teaching, we cannot do with the virtual methods, but for the pre and post conference, we use the virtual methods, and then the case discussion and case presentation, we use the virtual methods, and then the journal presentation also, and then meet the expert, we use the virtual method also. And for the evaluation method in clinical setting, we have some kind of DOPS and clinical comprehensive. We cannot do this with the virtual methods. Only case reports with the analysis nursing care, we can do this one with the virtual methods. So based on our experience, so I will say that this pandemic will forever shape the education landscape is already has, and I'm absolutely agree about that one. So we need to think about this situation. So we believe digital have a positive impact on nursing education. It is an alternative and support by learning process, but it is not the best choice for our nursing education in the clinical setting, in the clinical practice. We need to be combined with direct learning process in the clinical setting, I mean. And this is the evaluation. Digital learning have some limitation, I think, in especially in my experience. In general, facilities, internet problem we have about that one. And then for clinical practice, clinical instructor, preceptor, and also for the student, we need to adaptation for this kind of the technology. And then we have some problem with the ethical issue because of the patient safety and the privacy and the regulation from the hospital. We cannot do the bedside teaching, directly observe procedural skill outdoor and comprehensive clinical examination by virtual learning methods. So this is the challenge nursing education. We need to delay for some clinical methods learning which related with the patient in the real time. I just mentioned before. And we need to wait in for the best time to continue our clinical practice. So what is the best time? I think we can discuss with our clinical setting. And we start with strict requirement for the COVID-19 protocol in the hospital. For student, we send to a hospital. So we need to follow the local government and hospital regulation and hospital nursing program coordination. We need to have the coordination with the hospital and nursing program to discuss about when the best time the student can practice in the clinical setting. And also we need to parent permission and then willingness to finish nursing education practice for our student. And we need to have a rapid test in hospital for the student to continue our practice in the clinical setting. And in the short time in nursing practice with the skill targets, we need to have some consideration about the without COVID-19 wards and then COVID-19 protocol like physical distancing for skill observation in our student, and then we need to have some consideration with the DOPS non-COVID-19 patient. And then this is my experience, empirical phenomenological on student perception. We have 9 students in in-depth interview based on this experience practice in the clinical setting in this pandemic COVID-19. So this is the student perception. I just summary about this one. The technology, the student need to adaptation with the technology, and the facilities and internet problem, some kind of error, and then the unfocused learning, and we need to have some high cost for the from the student, and then physical problem like age problem, the student. And then the student perception, they have some thing about the fear to be unprepared in the current emergency work situation. The students say about the fail of lack of the professional knowledge and then hand-on skill, which which generates serious emotion of sufferings because they have limited time and they have some kind of the barrier to practice in the directly with the our patient. And then the treating clinical contact risk of infection, they mentioned, our student mentioned about the fear to the risk of the infection, and then the fear to risk the transmission of the family contacts, and the very anxiety and uncomfortable in the clinical nursing practice. This is our little bit experience in the practice nursing in medical surgical nursing. And finally, we need to adapt and adopt technology in the learning process as an alternative to learning methods. And then we need to keep our nursing clinical practice in the best time for our student to be a professional nursing in our profession. I think this is my short presentation today. Thank you so much for your kind attention.
Thank you, Mr. Wantonoro, for the nice presentation. I'm asking you to stay with us. Still stay with us since the third speaker is presenting the presentation. Now I'm going to please the last speaker who came from India. She is Dr. C. Kanyamal, MSc and PhD. Her topic today is clinical practicing medical surgical nursing student in COVID-19 in India. let me read the CV of hers. She graduated with Diploma of General Nursing in Stanley Hospital, Chennai on 1982 and Certificate of Midwifery also on 1982. She graduated with Bachelor of Nursing at College Madras Medical College on 1995. After that, graduated with Master of Medical Surgical Nursing at College of Nursing at Stafeta Dental College and Hospital on 1999. And after that, PhD of Medical Surgical Nursing at Sri Rahmachandra University on 2007. Experience background of her is the last 30 years she has worked as a college of the nursing, SRM University, also in the hospital, government hospital, and she has many publications, 11 publications in total, and 6 complete with the publication and 3 incomplete publication. To Dr. C. Kanyamal, MSc and PhD, are you with us now? Hello, ma'am. Hello.
Yeah, this very warm good morning to one and all.
Yes, you have time to deliver your presentation, ma'am, for 30 minutes. Time is yours.
Okay, yeah, okay. Thank you so much for a brief introduction about my what all the educational qualifications and the experiences which I have. Now I would like to focus the topic which it is given for me. So can that slide can be shared for me? Who is sharing the slide, please?
Okay, okay, ma'am. We will help you. Panitia, please.
Yeah, please. Yeah. Yes, the topic given here is the clinical practicing medical surgical nursing students in COVID era. So in India, how the people, the students are taking practice over here in India, in particular to our institution. So I would like to say some quote of some of the important thing. So which is the proceeding of the Indonesian presenter. So next slide, please. Move on, please. Next slide. Yeah. So the introduction, as a medical surgical nursing is a specialized and skillful branch. It is having a launch pad for all other specialities. So that like mainly cardiology, neurology, respiratory, oncology, and so on. Almost all the systems covered. Please move on. So here the medical surgical nursing, according to Lewis, so everyone know about the definition of what, so the specialized branch of nursing involved the nursing care of adult patients with various system focus and whose disease conditions are treated medically, surgically and pharmacologically. Move on. So it is continuing all the secondary responsibility, what all the responsibility of the clinical nurse as a student and as a nursing in the field of medical surgical nursing. Yes, move on. So here, in particular, the clinical nursing responsibilities, the collection of information and setting care is priority is our role, and applying novel method, and then planning of individual care and taking care of patient, assessing physical assessment and doing the diagnostic procedure, getting prepared for that. Move on. So the criteria, we have 2 criteria. So MSN, that is medical surgical nursing specialty defined, new competencies in the discipline for a nursing practice, and a medical surgical nursing specialty involved designing and special procedures for nursing care of the patient by using Nanda nursing applications. Yes, move on. And here, this is the time for change. So actually, what we are doing in the clinical scenario is entirely, it is it is turned back to little changes through online. So it is a time for change now. Yes, move on. So here, the role again, again, the roles and responsibilities are one and the same as like what we have done, and we have to implement it, but the methods and other thing only differing. So we have to just think about what are the changes, how our students will get adapted to. Yes, move on. So the ability to advocate for the patient's outcome, and these are all the previous scenarios, what are the, like an objectives and roles, what we have planned for in the pre-COVID era. Yes, move on, please. Still move on. Yeah, so these are four main themes, the ability, and then assessment, and then doing prioritizing care. Everything it is based on that skill which we learn from the clinical side, direct patient care. Yes, move on, please. So here the dimension of health now, it has become very drastic change. So normally, so the change, it is, so we know the WHO definition is health is a state of a complete physical, mental and social well-being, and not merely the absence of the disease. So the year 1991, they described as a holistic definition for any individual to become healthy. Yes, move on. So they focus the important dimension of physical health. So the physical health, everyone know what is the physical health maintenance with particular reference to. So that it means adequate body weight, height, circumstances, and all other basic information, and cardiac related events, that is pulse and all other things. This it has to go in normally. So for that it is maintaining of the physical health is very important. Yes, move on. So in this COVID era, I would relate with the physical health, what it is happening. So the physical health, we have to accommodate some of the changes. So that changes, it is mainly, everyone knows about how we are going to adapt with the physical, coping, physical coping, how we can able to adopt with this change. So that is the one we need to know about. So here, so the first one we need to the topping, that is glove, that is PPE, how you are going to wear and how we are going to remove that. So that both it is very high. So we may need to accept. So that is the thing. So the one here we have to see the step by step. First we have to do, so put on your clothings, the normal clothings, then go for washing hand, and then putting on the cap, and then the mask, then the gloves. So like that we have various steps, and then wearing that second gloves after that apron. So these are some of the important steps we need to protect our physical health. So any prior to touching the COVID patient, so that it is universal everywhere. And as being medical surgical nursing, we are handling patients, and the students are also exposed for some of the master students and post basic students may be posted in the clinical area after the COVID breakdown. So if they are coming, so that lockdown, they have to adopt this technology to protect their physical health. Yes, move on, please. So this is the one, how to remove back. So this is the, everyone knows about this technique to be trained for, how, which one it has to be the first glove. We wear the second glove, two gloves, so the outer gloves to be removed, and then later on. So all these things, the steps will teach you. So later on, because of the time lackness, I couldn't able to read everything. So we have to take care of. We have a topping and down that gloves and everything, how you are going to remove it. So that is also helping you to protect the physical health. So the why I am telling this one, so this one, it is very vital, because they have to protect their own physical health. Then only they can able to provide a quality and proper care to the patient also. So that's what, as being a student or a nurses who are working here, that is very important. Yes, move on, to protect their physical health. So this is also in adding to some of the clarity towards that procedures only, the how to do a gown technique and masking and goggles, eye protections and gloves and everything. Yes, move on, please. So here, in particular, so this one, I would like to focus more on this. Diet is very important. So whoever may be, that either the students or the nurses who are working here, so the diet, it plays a vital role because the immunity. No such particular treatment is available. Only the symptomatic treatment, the vaccines are also not available. So we have to protect our, so that the physical health and then the nutrition. So the nutrition gives a lot of focus for the your physical health as well, the physiological also. So here the immune development we need to have, so that all kind of protein, high protein diets, either maybe nuts or maybe meats and all other green vegetables and all other things. So we are, everyone knows about it as being, and vitamin supplements and zinc and some of the herbs like garlic and some of other garlic, that cinnamon. So all other things which we are using here in India. So very well, even in other places also. But we need to know what is the focus and how we have to incorporate in daily menu of our food. So that is very important to improve the immunity of the people, our own self. So that's the thing. The students have to be educated on this. Yes, move on. So here, as what is the thing? It is this model. It is the individual level. What is the food importance we have to do, community, and then national and global level. So from how utilization taking place by the individual and the community, how the it is support the food facilities accessibility, how for the community is helping. National, that food security and food product product companies and other things. Global market also. So these are the some of the everyone's responsibility. It is a global issue. So globally, it is very vital to improve the food and nutrition of any individual, in particular with nursing, frontier, lifeline. So and the medical people also as well, who are dealing with patients. Yes. Move on. So here the sleep. Equally, the sleep is very important. So the sleep, it says 7 to 9 hours of sleep is very vital for any individual. So the immune mechanisms also will improve. 5 ways how to improve your sleep. So there's these are the basic things, but we all people never follow that. So that's what I used to give more importance. The same types. So and then we need to go for sunlight. We need to expose for 15 to 30 minutes a day. And then we need to go for relaxation activities, some relaxation and before bed, something, some ROM type of exercises or mind relaxation, like whichever is preferred by the individual, and use the bedroom, and then calm place and avoid taking a screen or caffeinated drinks and other thing, because in order to have a sound sleep, at least minimum to 7 to 9. So this also will help you to improve the immunity. Yes, move on. And improve the physical health also. So the mental health, as already we told, so because everyone is anxious, particularly the adolescents who are in young age, and even in late age also, they are prone for a lot of infections. So this is the one we need to take a mental health aspect also. So this is our important thing, not only the physical, equally the mental health. It helps us to have a sound sleep and then immunity development and everything. Let's move on. So here the stress busters. So here all the time we need to have some relaxation, and some of the stress buster activities we need to take up into whichever it is preferable by the individual. So that is very, very vital, and that is needed for any individual, irrespective of age, sex, or whatever it might be, to relax your body and mind. Yes, move on. So here the mental health, the same thing. So we want to have a sound mental health. For that we need to take care of. Yes, move on. So this is spiritual. So again, adding to this triangle. So this triangle, the socialization. Now the socialization is more getting hindered. So because of only through communication of phone and other thing, we couldn't able to meet people. So a lot of social disturbances we have. The physically also we are getting annoyed. We couldn't able to go for even walk. And mental health is also psychological. All the three triangle, it is getting affected in a COVID period. Either the patient or the caregiver or whoever may be the relatives, even with the husband and wife or the children. So we are not keeping distances. So we couldn't able to touch each other. We couldn't able to have links. So these are some of the fear they have within self. So that is the one. So making become mentally, we are stay unstable. So for that only we need to go for stress buster or relaxations. So within the possible limitation, we need to go for take up some mental tool to avoid that anxieties and other things, fear, stress, everything. Yes, move on. The social well-being. So it is the, I know, so the social well-being, everyone knows we are not socially, we are having fear to have interact with the people. So I'm keeping distance. So these are the things. So this bit will hinder our social well-being. Yes, move on. So here the spirituality. So only thing, even if you take a spirituality, many of the temple, we couldn't even go for temple worship. Everything it is cut off during this COVID time. Only at home, by individual, at least to some extent, we need to calm the mind with through spirituality. Yes, move on. So here the determinants of the health. So basically, we everyone know the hereditary. So some have not having any PR, taking care of self or to the others, and moving around even after some from March, more than 4 months or 5 months, still we have a PR to have some, they have that mental capacity. So the inherent genetical makes also will help us to how to improve our health. And based on that, our immunity, and then here environment, physical, social, biological, and man-made, what all the thing it is helping and disturbing in normally also. So not only in COVID era, and health services, promotive, preventive and curative, rehabilitative. So these all the thing, it for the same normal situation also, we need to go abide with all these health determinants, and we have to utilize it for proper lifestyle changes and habits and everything. Here our habits, everything now, everyone is focusing on that masking, cap, gloving, and then the distance maintaining, so the hand washing. So these are the habits we regularly practice. Even in our nursing or anything, we are practicing, but now intensely we are practicing. Yes, move on. So here we need to have a balance between all. So the health, it's a fundamental human rights. First, taking care of any other individual, we have to maintain our health. So that is very important. As being a healthcare professionals, we have to orient our nursing students as well. Since they are in adolescent phase, they are not giving much importance for the health. So we need to emphasize in all these angles prior going to that subject. That's why I just narrated all about the pre-informations, how we can improve our body immunity and psychological keeping of mind calm, and how we can able to socially interact with other people with taking care of self. So that is the one we need to keep aware, make aware of that healthcare professionals, particularly the students, nursing students who are going to take care of in medical surgical area, direct contact with the patient after the lockdown if they come off. Yes. On. So here our curriculum. So here as like medical surgery, in particular only for medical surgical nursing, I am focusing. So what are the different programs and what are the things, hours based, how much it is covered for. So it is in our Indian Nursing Council and Tamil Nadu Nursing Council, they have some regulation. Indian Nursing Council, National Council, we have a master program, 2 years program, and then having a subject of medical surgical nursing, clinical specialty 1 and 2. So we have 2. So for that, the hours are somewhat, it is given the total 800 hours divided into 150 and 650 is the weightage for the practical component is more. And here as well, that second year also 150 hours of theory, but the practical component is it is almost nearing 1,000. So like that, the importance is given for the clinical focus. And again, coming to BS Nursing 4-year program, we have the UG, that is 4-year program. So with having a various nursing foundation course, medical surgical nursing 1 and 2, and again internship in the 4th year. So all the 4 years, the students are involved in this much of hours. So this is prescribed by the National Council, Indian Nursing Council. We have to give this much of our theory and as well the practical minimum requirement. Beyond to that, even 20% extra also we used to give for the clinical practice to enhance their learning skill. So on the clinical focus. So this is the indications where we are giving more importance. And again, coming to the post-basic BS nursing is another course, UG course, after the diploma. So as like the previous speaker told, that GNM course is also a 3 years course we have now. So this year they may have a plan to shut off this course and they may move upgrading to the BSc, but how far? So still it is available, the 3 years diploma course. And these 3 years diploma course will be converted into BSN, that is with the course, a bridging course of post-basic BSc nursing. And they can be moved for that graduate program. So they can get a certification of graduate. After 2 years of this training, these 3-year diploma will, after this 2-year program, they will be considered as that BSN, that is UG level trained person. And this is the focus now. In our nation is focusing. All the diplomas will be converted into this upgrading with this kind of education, post-basic BSc nursing after GNM 2 years program. So everywhere the medical surgical nursing focus and the hours distributions will be more for the clinical focus. So this is the slide. It is the important thing which we are giving more important for the medical surgical nursing. Almost all the year we have focus of medical surgical nursing. Yes, move on. So here some of the procedures of the OSCE types for a UG program. Our Tamil Nadu Nursing Council is having a logbook, same uniform standard logbooks will be given throughout the state. So it is given almost around 70 to 80% of UG level topics. So which some of the topics we used to go for 70%, minimum 70% to 80% at the bedside, and 20% we used to take up in the lab or a sim lab, like we used to have a normal practice. But now, so it is changed. So now it is almost we have completed some 50 to 60%. The COVID era, it is blocking that. So now we are moving for little more only in the clinical area and online only. So the clinical area we couldn't able to take up now. So only we are just going from March onwards, we are trying through online only. Yes, move on, please. So this is a continuation of the previous slides. So the UG level procedures, move on still. Next slide. Yeah. So here almost more than 60, even next slide also. Next slide. So almost around 78 to 80 procedures concerned with UG program. So it depends on the syllabus. Some of the procedures can be divided into first year, second year, and third year. So like that we will divide. So and then we will provide bedside and as well in the laboratory. In the beginning laboratory, and then later on in the bedside. With simulation, we have a simulation lab also. So that's why the students will get more adequate hand skill. Yes, move on. So this is coming to the PG level. So the PG level, little more advanced procedures is given in the log. And now the focus is the respiratory. So that's why I just displayed over here, because the COVID is more affected with that respiratory system, but inclusive of other systems also in later critical phase, but primarily it affects the respiratory system. So the PG level students are doing in-depth assessment, and UG also they are doing, But PG and the nurses will be posted, the already trained nurses will be posted in the ICU setup. They should be learning ASCII type of learning through online we are providing now. Yes. So here, some of the advanced procedures at the PG level, and even advanced third year students also used to have these kind of procedures. Yes, move on. So now this is the pulse oximetry. So here the pulse oximetry is everyone knows now. So because each and every common people, so they are assessing the oxygen saturation because they would like to know about it is encouraged and it is provided by the government also to the people who are in need. And they are sponsoring and they are getting on their own also. They used to get to identify the oxygen saturation. It is a non-invasive method. So everyone now they are aware of, even the general public, to know about the oxygen saturation. If it goes less than, so that is it should be always greater than 95% SpO2. If it is reducing that, we can classify this mild, moderate, and severe. So 80 here that is beyond to this 91 to 94. So it is considered to be mild level of that saturation. So it is having indication of COVID also can be linked with this. So that's what. Now it is very given more important for this. So I would like to display this one. And the mild moderate category is 85 to 90% of the oxygen saturation. It can be easily identified through this pulse oximetry. And then the severe type, it is less than 85. And what kind of interventionals, nursing intervention we have to focus for this? If it is normal, so we can just very well monitor, and continuous routine monitoring is adequate if it is greater than 95%. If it is less than that, so that is till up to 91 to 94. So then considering the borderline, so the patient or individual may require that administration of oxygen. So that is 2 liters per minute. So it is indicated. And as well, if it is going for a little more severe, so that little more moderate. So 85 to 90%, less than 90, up to 85. So we have to be treating with another thing. So it is elevating of bed and getting the patient will get a breathing difficulty, coughing, airway, suctioning is needed, and the oxygen administration little more higher. So even the high flow oxygen, if necessary, also it has to be administered in the hospital setup. So this one mild level can be treated even at the home level. So that, but here in moderate and severe level, definitely they need to go for hospitalization. So this indication, it will help them to identify in which level the patients are. So even the common public, they are aware of, not only the nursing personnel, but we can guide them what is their expected treatment line for this kind of oxygen saturation. For the 100% oxygen administration is needed hospitalization in ICU in time if it is less than 85% of oxygen saturation through pulse oximetry. Yes, move on. So here, some of our students, our nursing teachers are doing demonstrations in our nursing foundation lab. So in medical surgical lab, so they are giving some kind of training with the modules. So that is the thing. So already we have done. Now also we are repeatedly with the social distance. The teachers are following in the earlier phase, but later on they left because they couldn't able to stay here all the lockdown, and they have sent back the students. Now all the students are at their home now. No one is here, but only the teachers are working through online over here. Yes. Yes, move on. Some of the previous slides only I am telling you. So there's the foundation lab, what kind of procedures we are, and even after the students comes also, we are utilizing this kind of labs only because we couldn't able to immediately place all the students there in the clinical area. So we have 1,200 bedded medical college attached hospital within campus. So it is adding strength for our nursing students. But we now, if they come, maybe after a month, also we couldn't able to immediately place them over there after slowly with the social distancing, we don't know when the corona will leave us. So we have to live along with and how to maintain the social distance, how to split the students in the lab learning, classroom learning. So like that, and the clinical, very less students, maybe in the senior students, we may have planned with the standing operating procedures. Yes, move on. So it is the lab, simulation lab we have within hospital. So we have a medical college simulation lab. Our students are also getting training in that simulation lab. And the advanced learner of masters will be given some adding simulation training and self-learning, video assisted teaching, brainstorming sessions, and concept mapping also. And OSCE is predominantly going to be adopted in future. So now it is online, even in offline also. If after the coming, so if the students coming after the COVID era, so they will be planned. We are going to have a plan for all OSCE type and simulation learning and self-learning desks and video assisted teaching, brainstorming and concept. These are the plans we have according to the students' level. We used to plan these kind of modified method of clinical upgrading skill. We have a plan and we prepared all the tools and everything. It is getting ready for the students. If it comes back, we used to apply on that. Yes. Move on, please. So it is another procedure with the social maintenance we have within the lab facility also. We can able to have individualized or a small group learning after COVID effect. If it comes also, our teacher is doing demo with a supervised demonstration with the students with the social interaction. So some students, they stayed for some time over here in the COVID era, couldn't able to go for an outside. So by the time the students utilize this labs experiences. Yes, move on.
Sorry, ma'am, you have 5 minutes to go.
So here, the examination, not only the clinical practice, even the examination. So also now we are in conducting online exams, both for the theory and practicals, and then for getting ready for internal assessments marks according to our guidelines received from the National Council. So we are utilizing this kind of online practices of conducting exams. It is a challenge for teachers and as well the students also. So it is very difficult, but we are learning, and the teachers are put forth at getting scenarios. They develop new case scenarios, how we are going to face that examination challenge for that question pattern. Everything it is changed now from the normal routine. So now they are getting ready for, yes, now the model exams are going on. So now earlier, so even the advanced procedure with the patients, real patients in the medical college, our students are observed by our teachers, and they be as a role model, and they do demonstrate with the clinical environment. Now the changes, yes, move on. The challenge. So that this is a real challenge, like real on-patient skill-oriented capacity is not able to be obtained by the students if it comes. But after the quarantine, the social distancing we have to maintain. So that's what I told, that online practices, it is getting ready by the teachers, how to receive the students after the lockdown period. It is more difficult for the teacher side and as well the student side. How even the students and parents are also asking. We used to conduct online parents, the teachers, and as well students meeting also regularly. Bi-weekly, we used to meet the parents also. What are the difficulties and how the students' perceptions and everything we used to assess. All the mental health faculty is allotted for, the department is allotted for the counseling session to have some support and coping strategies for the parent as well the students. Yes, move on. So here, the doctors are also used to give a physical examination classes will be involved in the COVID, even after the COVID, if they come also in a small group, if it's so. So some patients in the normal ward can be utilized for some kind of clinical skill. So that is the plan we have. Yes. Move on. So here it is the clinical, we can use that clinical demonstration. So in the lab, so we have a simulation lab. So there we have a lot of CPR models and all other advanced models we have. It is a well-recognized center we have in the medical college campus, and 6 teachers of us nursing teachers have been trained already, and they are giving supervised learning for the students on self-learning. They do a simulation on the models at the labs. So it is our students. Yes, move on. So here the nursing students after the COVID era, if it is same or different. So I told, so it is different. So that because all the time it will be vice versa. The 70% and 30% already told that 30% we may try to have a plan to place in the clinical area. The 70% we will place it in the simulation and as well in the laboratories and as well in OSCE stations in the classroom with the social maintenance we are planning for after the breakdown if the students comes. So that is the changes. The online clinical learning and then the conceptualization already told about the methods and other things and alternative clinical experiences we are planning for. Yes, move on. So the online examinations, so even in other countries, some of the research findings, they used to in California. So some of the findings, they also give the grading. So they all pass with the previous existing marks. They used or some kind of online examination with the internal way, not the university conducting, the college conducting internal way. So it is some of the reference based on these kind of references, even our regulations. Yes, move on. So this is continuity of that some research finding in other areas, how they carried out. So in California and Iranian studies, it has been mentioned over here to know about what is the things it is happening in and around. And our national council, yes, move on. Also used to give this kind of suggestions, simulation, telehealth, and virtual reality like. So recently, the telehealth, the telemedicine also, they become started in our campus, they inaugurated. So slowly, in future, we may have utilized that, that kind of telehealth facility also for nursing. Simulation already, it is strengthened. We have, and virtual reality and telehealth is expected to in future, we are also incorporating for our nursing. Even in the new regulatory syllabus also, it is included. So we will also have changes after the COVID era. Yes. So here, best clinical practice, it is based on the course and then the lessons and everything. So the flexibility we need to give in all the way. All these things, we have to give a flexibility. So here, you know, so that society, so the American Nurses Society and all other places, the organization also, they are recommending for that simulation in healthcare is very vital with high fidelity mannequins, and that clinical learning can be enhanced. So that is the thing. And again, the PPE. So it is a challenge is the PPE. So when the students go to the clinical area, in-depth area, for example, so maybe moderate level of affected people, COVID area, and then maybe the pre-COVID area. So like that kind of areas, so they need to wear personal protective equipments also. It is also a challenge. It is not available many a time. Only the healthcare workers who are in direct care only they can able to be afford for. So it is costly and non-availability, a lot of issues. And even the aged people, if they go, they need to wear on. So these are some of the challenges we have to meet in the COVID era, post-COVID era. So that it will not leave. We cannot say post. So it will be ongoing for a few years. So we have to live along with how to take care. So that's why the clinical learning will be little less. So maybe 20 to 30% we may have a plan, and another 70% we will have it in the labs and the classrooms. Yes. Move on. So here, this is what the simulation center, which are we have in the medical college. It's a very wide in Asian top level mentioned in American Heart Association also have certified this simulation center. So it's a very big center, and our students are also getting trained in this. And our 3 adult health nursing staff faculty have been trained for specifically for the simulations, and those people will be adding strength for the student. And for the pediatric also, they have 3 faculty trained for, and pediatric simulation is also possible. To our students are more utilizing this area. Yes. Move on. So this is what a lot of mannequins were within the simulation lab, and at a time, so where the students can be given taken care of. And apart from this, certificate course are also conducted. Maybe that ACLS, BCLS courses, our teachers are also trained in that. And all our existing students, 4th year students, it is mandatory they need to certify, and they can, prior to leaving this the college, they are certified with this ACLS, BCLS training. So that is mandatory. And during learning, the other phases also, we are some of the procedures and all other things, it is demonstrated in the simulation lab. Yes. Move on. So here, the students do, the master students are taking a clinical demonstration and written demonstration by the UG students in the simulation lab. Yeah. So here our teacher, his observer is there. To after the CPR, what is that monitoring? So changes it is taking place. So then with the monitor, with the demonstration, the teacher is doing demonstration with for the students, UG level students. Yeah. So here again, so this is the master students about the ventilator setups and other thing. It is simulated here with for the UG students. Yeah. So moving forward, so a typical first response to COVID-19 experience may be added to, so that it is a reinforcing content about that infection prevention. So that it should be added into the curriculum. So that is the emphasize. Now even the regulations, national body is also coming around with a new regulation syllabus. Shortly we are expecting. So this kind of infectious disease specifically can be incorporated in the syllabus level. And the American Association of College of Nursing also suggested minimally, so that such topics as surveillance, and then the surveillance, isolation, quarantine, and containment, and proper hand washing technique, coughing and respiratory etiquette should be added and addressed. So they are also suggesting. So the curriculum has to be enhanced well in future for nursing to enhance in depth about these kind of pandemics. Yes, how to take care. Yes, move on. Next slide. Yeah. So here the Indian Nursing Council recently, so they have given that standing orders or regulations. In the month of July itself, they displayed how far the COVID pandemic era, how the students can be upgraded for the next year. So that is the thing, it is become given here. So since it is not visible, I have put it into the script form in the following slide. Yes, move on. This is our Tamil Nadu Nursing Council. So we have a state nursing council regulation also. They used to have continual recognition, renewal, all these to have every institution. They used to direct. So that is based on the INC guideline, the Tamil Nadu Nursing Council, the registering body, and as well some of the regulation also will be followed as such by the INC. Tamil Nadu's State Nursing Council is also helping in arranging the Google platform for the students, and they have taken effort to throughout all the Tamil Nadu students. Many students, they may not have the possibility of internet access and then all other things, as like some of the private colleges, some other colleges, they not. So that's why the State Council initiated, they have started the Google Classroom, and they used to give content, provide content through Google Classroom throughout the Tamil Nadu. All the college students get a benefit out of that. Yes, move on. So the theory, online theory classes, the mode which we are following here is Google Classroom, as I very well told about that Tamil Nadu Nursing Council initiated. The Zoom, WhatsApp, Facebook, and college websites we are utilizing here in our university. And now recently, we have a plan for learning management system also. Already we got a simulation and demonstration by the learning management system. So we are having a proposal of getting entry into learning management system. So that is also a wide mode of spreading through, we can able to incorporate many things for the student access materials. So learning management system. So that we are shortly we may expect landing into our institution. And teaching methods which we are following, lecture through PowerPoint, and providing a study material, and giving an assignment, assessment via online, so that through examinations. So like that we are following. So there's some of the teaching methods. And for the practical we have, it is for a theory. Yes, move on. So for the clinical, so the virtual learning, we have a plan, and shared recorded visuals through the clinical procedures also we need to go online, and digital resources availability, we are utilizing that. And period of lockdown treated as here, the INC, it is emphasizing all the that online classes, the period learning, everything is included for the attendance calculation. And the college reopening, after the college reopening, we are exclusive clinical blocks, revised master plan and clinical rotations. We have done it already. So then we slowly, we use, because as already told, 70% of the students will be placed here in the college labs and simulation lab and other thing. And only 30% we may have the non-COVID areas, we used to place the students to face the challenges. So because the students and parents, we all are very much scared to take care and go leave the students in the clinical. So and we too also, we modified our already planned clinical rotations and everything. Yes, as per the guideline of Indian Nursing Council, State Nursing Council also. Yes, move on. So here the attendance, the practical attendance, the weightage, our council, it is regulated. Usually we need to have, in prior to COVID era, 80% for the theory it's mandatory, and 100% for the practical is mandatory to appear for exam. But now they relaxed into, so that 80% for the practical is adequate, not necessary for 100. So that is the change. And in this 80% also, so they divide into the skill lab, clinical procedures. So it can be utilized for 30% only till up to 14.5. Now they relax to 30% to 40%. The procedures can be upgraded here in the lab itself. And later on, you can move to the clinical area and have the remaining balances. But for us, already since we are falling under the annual year program, now currently we have not having a semester pattern. So we already have completed 60 to 70% of all the procedures in the clinical area itself. Now this 30 to 40% we are utilizing for the clinical learning in the lab, and as well the simulation lab, as like the guidelines it is given. So recently they have incorporated that as MLHP, that is inclusion also. It can be completed through simulation. So some adding to syllabus. So it is also based on the need of the society. They added this clinical requirements. This also can be completed in our labs itself. Yes, move on. So here internal practical evaluation, and that is the OSCE type. So we used to have a type of OSCE. So the observed, even the Indian Nursing Council, national body, it is advocating observed structured clinical examination can be carried out through online. So to avoid the students to expose, so or through online itself, so it is planned for. So according to the Indian Nursing Council. Yes. Let's move on. Next slide. So the external final examination, it is going to be conducted for the final year. Final year, for example, in master's second year, MSc second year, and the BS nursing fourth year, and then diploma in nursing third year will be given on-campus examination we are planning for at the end of September. Already the schedule has been planned as like, because since they are exit, and our council, Indian Nursing Council, also emphasizing the final year's examination has to be in par with the previous existence, with maintaining the social distances and only some relaxation. The hours of examination can be reduced into 2 hours. Rather, the earlier we have 3 hours examination for the university. So we are now reducing into 2 hours of examination, and in a shift-based manner we are planning for. So maybe that morning one group and then afternoon one group, because the social distance we need to maintain for. So like that it can be, and staggered timings of the timetables and everything we are modified as like it is not as like the other previous existing exams. Little modification to maintain the social distance and protection and prevention of infections. So this is also a change we are following now. For the final year exams will be conducted from the end of September end to October first week. We have a plan now. We are going to conduct this for only for the final years. Yes. However, the clinical examination we used to conduct, the possibility we will check through either in the clinical to some extent, if not in the labs only we are going to conduct for. And the marks also, now we have a change. So only for the other groups, I'm telling for that fourth year, the final years will have the same ditto of the previous examination they are going to conduct. But for the others, first year, existing first year, second year, third year in BSc nursing, and existing master first year and existing post-basic first year students will be given of 50% internal weightage of college online examination will be conducted. They are not coming to the campus. Online examination conducted by the college. And then 50% of the marks already they have scored in all the average performance of all the college theory and practical examination will be taken care for 50%. And the 50% now currently, so in the September mid, we have a plan for online examinations for the group of the existing students, not the leaving students. So now final years will be coming to the campus and conducting as like the previous pattern of exams we used to do according to university. And the college level examination online will be conducted for the other existing batches, first year, second year, and third years like. The final years alone will be on campus they used to come. Yeah. Yes. So this is standard operative procedures, reallocation, the standard government operating procedures. So they have planned non-COVID area, COVID area, looking after patients with mild to moderate, and COVID area with the severe patients, so as what we have seen. So that is in the earlier, it has been classified. Our hospital is classified like this in ICU also. in this way, the hospital become, in this COVID era, it has been classified. So here, in addition, the triage in the emergency department also has been created, how the patient will be diverted to from the casualty. So that is the triaging mechanisms they used to adopt here in emergency, and they used to just categorize the patients, and they used to send the zone where they are in need, maybe non-COVID area, or maybe to the intermediate COVID with mild moderate, and then to the critical area. So like that it is classified. Yes, move on. And according to the postings, the level of areas will be, first one is the screening. Facilities level will be categorized in this screening area, and then non-critically ill patients categorized, and then again the critically ill, hospitalized patients. So like that, they used to categorize. The facilities also has been 3 level, they have been classified in the hospital. Yes, move on. Coming to training of the students, of our nursing students, how it has to be after this. The task force. So they are also emphasizing the government rules and regulations here, responsible for retention of the nursing students also, and or the MBBS students, how they have to follow essential training module. For example, in the beginning, I told the PPE, how they have to wear, and how we have to topping and dunning and topping, how it has to be done. The training, it has to be given for the nursing students and as well the medical and other health team. So that is the training we need to give for, because wearing and removing also, it's very important to prevent the infections or to protect them their self also. So that is the technique and the training, it has to be given prior placing into the clinical area. Even if the students comes after the COVID area also, they have to be trained for PPE. So how to wear and how to remove. So that is the thing they have to be taken care. With the training only, they can be again placed in the wards. Yes, move on. So here the nursing students, allocations to be handled in manpower. Sometimes maybe because of the staff nurses and other thing, it is reduced, because due to the lockdown period, many of them might have gone, leave the job, or like that. Some incidents also might be happening in many of the hospitals. In that case, sometimes our nursing students, medical residents, final year may also, now current 3rd year will be final year coming after the exams. So then if they are coming, then if the need arises, they may even place in some of the in between moderate COVID, that is COVID area, mild to moderate. Sometimes a little more senior students, they may be placed in ICU also. So we need to have a proper training for them. So that is very vital. So to protect them also for from getting infected. Yes, move on. So here, so we have a plan like this. So that the first year and second year, we are considering as like novice. So these people in non-COVID area only, we have a plan, even though if we have a plan to place it in the area, clinical area, first year and second year students of BSN and the diploma students will be placed here in non-COVID area. And then the BSc nursing with the honors of a 3rd year and 4th year, little bit trained person. So we can be utilize it for mild to moderate area, that is second area of COVID impact. And then the master's level trained student. And then again the post-basic students are also working, were working as a staff nurse after the GNM. So they have an experience. So they can able to cope up. So that's what we may have a plan for these 2 groups. Some little bit training, clinical training already they have, and they are a little matured. So we have a plan to, if they are in need, we may train these students for severe COVID-19 patients taking care. So these are some of the tentative plans. According to that, even the standing operating procedure also given guideline. So like this, you can able to place the students after the COVID era, if they are coming back again. Yes. So now we are coming to the conclusion of only with 3 points. I would like to emphasize what it is. So here, so the COVID-19 here rapid spread, everyone knows about it. It poses a serious threat to the human health overall globally, and is the impact of severity in the public health, global communication, and economic systems. It is getting affected throughout the globe. And coming to nurses are the key member in the healthcare team, and it is changed to control and prevent the spread of infections, infectious disease. Moreover, the nurses work on the front line. So as already told, providing a direct care to the individual is infected with COVID-19. It is a big challenge for the nurses with protecting self and the patient. And coming to here as a students and the nurse educators can help in documenting, analyzing the effect of current changes to learn and apply new principles and practices to the future. So we are in a position to help them in documenting and analyzing the effect of current challenges and conducting some studies, evidence-based, and apply new principles. So these are the things, it is awaiting challenges in front of the nursing students and as well the educators. And we have to help in hand of the healthcare team to move with the possible challenges because of the COVID and post-COVID impact in future. So this is our overall, by and large, role of a nurse and as well the educators and the students, how to cope up with the existing challenge. We have to, it is a very big question we have to think about and we have to work on. So this is the challenge for each and every one of us as being nursing personnel. Thank you very much for the patient listening of I might have a little bit fast. If any clarifications or doubts, you are most welcome. Yeah.
Okay, ma'am. Thank you so much for a wonderful presentation.
So I couldn't able to hear here. Unmute here.
We are louder already. You cannot hear.
Not able to hear. Please unmute.
I'm talking right now, ma'am. You cannot hear my voice.
Not able to hear. Yeah.
We're not able to hear. So how I should ask you? Many questions are here. Do you maybe need the speaker to connect to your phone or laptop?
Sorry, I couldn't able to hear. Please be louder and unmute.
Okay, the first question. Thank you for the nice presentation, ma'am.
Yeah. Thank you so much for providing opportunity. Okay. And I like the Indonesian presentation of the previous speaker also. I learned something through his presentation and what it is existing here in India. So exactly, I have just put forth in front of you. And any of the questions you can please have it now to have for a discussion.
We have questions here. Yeah. I will just read that to you. Some student from Cikini Nursing Academy, she wants to ask you, is there any rate of incident that the nurses was infected during the COVID-19 while giving caring in medical surgical in India?
Yes. Nurse, yeah, there are few taking care of a person. They are also getting affected, but they will be provided with all kind of facilities and admissions and freeness and treatment, everything. But with asymptomatic, sometimes one or two they got even get a low positive and they got treatment and get cured also. No harm in that. No losing of life or anything. But they got infected, very few nurses, and they got treated also. And after taking care of the patient, they will be given, as like in the wards, the nurses' shift will be only 4 hours, not 6 hours or 8 hours. The exposure we have reduced. Only 4 hours shift it is given. because the PPE wearing for all the lengthy of time, it is very difficult for the nurses. So we were giving only 4 hours shift. And after that, so they will be leaving off. And after they taking care of a week or time, they will be given some quarantine time also. So like that, the rest time also will be given more for them to improve their health and other thing, and to quarantine them. So frequently they are quarantined to take care of their health.
Okay, next question, ma'am. How does your institution carrying out the clinical practice learning process in this COVID pandemic?
Yeah. Yeah, because your speaker, please increase the volume. I could not hear.
Ibunya yang nggak dengar saya, bukan saya yang nggak dengar dia. How does your institution carry out the clinical practical in the COVID-19 pandemic?
It's not clear for me. It is not loud also. It is not clear for me, please.
Are you able to see the chat room?
Yes.
Are you able to see the chat room so you can read from that?
Chat. So in the chat, if it comes also, I can able to see.
Yeah,
I couldn't able to hear it.
I send it to you by what's that? By message.
Sorry, I couldn't. Because I don't know where is the problem, yours and or mine. I don't know, because I'm having it in the mobile. So the technological issue.
Okay, for a while, please. Apakah Aiki boleh mendengarkan suara saya? Clear? Hello, panitia.
Yeah, please just put it in that slide, no? So then I can also answer for.
Okay, ma'am. I'm going to give that. For a while, please.
Yeah. I mean, it is not much clear, the question.
Yes, for a while, please, ma'am. I'm going to send it to you by message. For a while, please.
Please send. Yeah.
I send it one. Please answer, ma'am.
How does your institution carry out the clinical practice? Yes, once more, please.
How does your institution carry out the clinical practice learning process in this COVID-19 pandemic?
Now we are not, the students are not at hand now. They are coming maybe in the September end, they are coming for only 4th year. The all other years, the examination will be conducted online, and following that, they will be continuing for the next year through online only.
Okay.
Until they will be waiting for some time. So after the government and everyone, they relax only. The students are not yet returned back home.
Okay, ma'am. I got it. Are you hear my voice now?
Yours in your place?
I'm here. Do you hear my voice, ma'am?
Yeah, a little bit. So it's very slow, but yeah.
I am in the mouth of the speaker right now.
Yeah. Okay, no problem. Yes.
Okay, this question came from Alfian from Fatmawati Nursing Academy. How to apply social well-being of psychological well-being during the COVID-19 in India? So Indonesia maybe can adapt that.
Yeah, this social well-being. So we used to conduct stress buster classes for other working nurses. Our faculty from mental health nursing is more trained in that, and she used to go and have some of the situations, scenarios, and making game plays like so like that. They used to have some stress buster activities for the nurses in working in the area. Now the students are not working there. The nursing working staff nurses are gathering every Wednesday, and our faculty from mental health area, they used to go and creating some game like some interactions and conducting some stress buster gaming. and they relax and make them to have some of the technique. It's to follow some breathing exercises, mind calming, so that everything they used to go and give some of the relaxation techniques.
I'm talking right now, ma'am. You cannot hear my voice.
To get a social well-being, yeah.
You're not able to hear. So how I should ask you? Many questions are here.
Yes.
You maybe
Any
need
other questions?
to connect to your phone or laptop.
Sorry,
Yes,
I
ma'am.
couldn't able to hear. Please be louder and unmute.
Okay, the first question. Thank you for the nice presentation, ma'am.
Thank you so
Thank you
much.
so much
If
for
any
a
other
very
question, you please send me through mail. I can also answer too. So thanks for the very good opportunity to meet you and to provide just to say about few words about what all the thing it is existing over here. And we are sharing information from Indonesian organization also. We are learning from, and we too also shared some of the experience we learned so far, so that it is useful for our entire nursing fraternity. I'm so much thankful for our IR office, and then the persons who you from your office is given arranging very well organized arrangement. And so this is a very good platform for us to learn more to interactively with each other.
Okay, thank you.
Thank you so much for patient listening and giving time for me to have some discussion and other thing. I'm thanking each and every one of you for the organizers and our IR office people, and as well the participant by and large, to make use of the sessions effectively.
Okay, ma'am. Thank you.
Thank you
for the
so much.
presentation.
Thank you.
Hopefully
Thank
you
you.
can see another occasion. Thank you. Another speaker, so going to answer the question is Mr. Wantonoro. I please you to answer this question. The student who asked this question is Gloria from Cikini Nursing Academy. The question is, how about the professional nurses who work in the hospital when she or he made a mistake and caused a patient death? Will she be fired or blacklisted as a nurse? Thank you.
Oh, okay. Okay, I will try to answer this question. This is a very good question. I think this case depend on the case. If your practice is not in the your competency, and then not in the standard operational procedure, you will have some problem. But this is judgment by we have the ethical committee in the local hospital, and then we have some local regulation in the hospital, and then we have the committee in our organization, I think.
Thank you so much, sir.
Okay.
I found only one question only for you. Oh, yes, only one for you.
Okay, I'm happy to hear about it.
Presentation. See you again in the next occasion. We hope we can share experience also. Thank you so much.
Thank you, thank you.
And then we are going to the second speaker, sorry, Mr. Regidor. Are you with us right now? Hello, sir. Hello, sir. Mr. Regidor. Hello, sir.
Hello.
Yes, sir. This is your time to answer the question. I need you to be prepared. The first question that I have told you for a while, please, came from Devi Susanti from Mitra Keluarga, Stikas Mitra Keluarga. The question is how to increase immunity in patients who have chronic kidney disease and cancer in pandemic COVID-19, which we know that they have stress and more anxiety with this condition of COVID-19, of their condition. How about your answer?
Hi. Yes, this is for Devi Susanti,
Yes,
right,
sir.
from Stikes Mitra Kaluwarga. Okay, how to increase immunities patients who have chronic kidney disease in pandemic COVID-19? Well, first of all, we ask them to have bed rest because rest is very important. And we usually give them hyperbaric oxygenation. Oxygens in terms of giving them nasal cannula, to increase oxygenation because more oxygen can kill the virus. And which another question is, which we know that they have stress and more anxiety with this condition of COVID-19 and their condition with their disease. Yes, they do have stress, but that is not curable because uh, they have low immunity and they have chronic kidney disease. Definitely, stress will only be relieved through complete bed rests and oxygenation. We give them oxygenation in the hospital setting, but at home, we ask them for rest, and the diet is for renal diet. Not too much water because the kidneys cannot afford a lot of water. Low level exercises will be fine, such as deep breathing exercises, range of motion exercises, and the like.
Okay, thank you, sir. The second question came from Nurse Sestramita from Nursing Academy of Fatmawati. Some studies positively identified cytokinin storm of COVID-19 signified to the acute kidney failure and needed for dialysis. And it's one of the major causes of the death. Is there any data related in Malaysia? How about the mortality? And the second one is she's asking about this. The second one is maybe you can answer it first, sir.
Yes, from Sestramita, from Fatmawati. Thank you very much. Of course, there are mortality rates of cytokine storm cytokines for COVID-19, and it is an acute kidney failure, and they need dialysis because of septic shock. There are mortality rates, and they do die. It's high incidence of death because of septic shock, and cytokines such as interleukins and all, they have increased in COVID-19, which leads to acute kidney failure. And dialysis is there, of course. Dialysis is there. Is there any data related in Malaysia? Yes, there are statistical data that has not yet been published, but there are a lot of data that is related to cytokine storm from COVID-19 cases.
He is also asking this, sir. What is the type of PPE used as standard in the same in the new normal era in Malaysia? Is there any special treatment to approach that chronic kidney disease patient who already low in immune system?
Okay, again from Sestramita Fatmawati. The type of PPE definitely is recommended, the mask, the N95 mask, but simple face mask will be fine as long as there's filter, which is recommended by the World Health Organization. But in the hospital setting, we use the mask that is N95 type, and we use gloves. Definitely, we need to use gloves when we're trying to touch their ports, the dialysis ports. Um, and is there special treatment to approach the CKD patient who already low in immune system? There are no special treatments. There are general treatments for them, and they are low in the immune system. Therefore, they are standard treatments and standard precautions are there. We don't have physical contact. If we have, we use gloves and gowns. We do use gowns, and we sometimes use face shield. Face shield is very important to protect the eyes and all the soft tissues that are exposed in the faces that can also come in contact with coronaviruses.
Okay, sir. You have a lot of questions here. Another question here came from Dea from Nursing Academy of Cikini. What is really the complication of that chronic kidney disease, when they get COVID-19, you taught that before, maybe you need to remind again. And how about the dialysis? Is it possible to do again or maybe another treatment? Can you explain, please?
Right. Thank you very much, Dea Chantika from Chikini. Um, yes, of course. COVID-19, do they still have to do hemodialysis? Of course, they still have to do. And is it true that if he's positive or they are positive for COVID, he has to be isolated? Yes, they have to be isolated. They have to be isolated and they will still do dialysis. They will not stop doing dialysis, but provided that they will be isolated if they are positive. For the three cases that I've presented to you, they are not positive with COVID 19 and they are doing dialysis. They are potential for having COVID 19. If they will acquire COVID 19, they will still continue with dialysis and they will be isolated.
Yes, sir. The next question came from Rachel from Karis Husada Nursing Academy. He wants to ask you about the patient with the dialysis, hemodialysis, need a rapid test before or and after dialysis therapy is given, and even the rapid test result are reactive, can hemodialysis still be implemented?
Thank you, Rachel. Carrie, you have similar question with
Yes,
the other question. So the answer is yes. They will still have to do rapid tests, which is the blood test. And if the rapid test results are reactive, they will still do hemodialysis, but they will be isolated from the others. So hemodialysis will not stop even if you're positive with COVID-19.
Another questions from Bernadetta, Pasar Rebo Nursing Academy. He wants to ask you about this patient. When the patient being isolated and patient has phobia of being alone, which should we do?
Well, thank you very much, Bernadetta from Pasar Rebo. It is a very interesting question, which I also have given to the recommendation in the nursing management to devise new ways on handling these patients on loneliness because it takes 5 years to create and standardize new ways on being effective in relieving the phobia and the loneliness. After 5 years, maybe we will standardize. But what we do in Malaysia, what we do in the clinics here, we give them handheld devices, handphones, so that they can play while they can socialize through web pages, through social media. They can still connect with others, not getting physical contacts, not getting direct contacts. Those are the things that can be applicable through through handheld devices. There are a lot of high technologies that are being developed in Malaysia, such as the virtual reality. Well, we can do virtual reality. We give them virtual realities so that it looks real, that we are so close to them. It looks real in the virtual world. And you can use your gloves with virtual reality and it feels like you're touching them as well. So those are the new technologies that are being using all around the world, especially in Malaysia, with high technological devices that can seem to be in close contact with patients, even though you are not, even though it's just in an imaginary virtual world. So those are the things that we are doing here now, but it is not a standard way of relieving phobia because the psychological effect may be studied starting 2020, and it will be 5 years from now that we can standardize these experiences, the lived experiences that can relieve phobia. After 5 years, maybe we can have a conclusion on this phobia, but as for now, it is still inconclusive, which is I have recommended as an action plan or a call for action for all the nursing managements to do some research regarding this psychological effect during isolation among patients with COVID-19 doing dialysis.
Okay, sir, we got it. Actually, Nur Aisa from Pelni also asked about that question. It's the same, and you already answered that question. I think Ain Aisa Anissa Rubiatullah from Pelni Nursing Academy already understand that question and answer. And then maybe the last question to Mr. Regidor. If a kidney disease came from Adinda from Pelni Nursing Academy, I want to ask Professor Regidor if a kidney disease patient with positive COVID-19 wants to undergo dialysis, is there any different procedure with kidney dialysis patient without COVID? So the differentiation only, maybe to remind only.
Right. It is. The answer is yes. Thank you for that question. The answer is yes. It's an isolation precautions. Those are the very special precaution that needs to be differentiated between those who are positive and those who are negative in COVID-19.
Okay. Is there any questions? For a while, please.
I think there's some from Jalita Putri.
Jalita Putri, yes, sir. From Cikini Nursing Academy. What if a child turned out to be infected with COVID and the parents don't know? Can the child spread COVID to their parents? Thank you.
The answer is yes. The answer is yes. Thank you for that question, Jalita Putri. Yes, the chain of infection doesn't stop with the age group. The age group can have acquired or carry the coronavirus, and they can transfer it to their parents. Therefore, the answer is yes, they can infect everyone.
So that is the last of our discussion today, and sorry for the disturbing situation that happened a while ago. We do not know where's the problem. And anyway, thank you to all the speakers who have delivered the speech now. Hopefully in the future, we will have another occasion, another event. Of course, we can share our knowledge and experience. Thank you again to Mr. Regidor and to Mr. Wantonoro and to Dr. Kanyamal. As a moderator, I'm going to give a conclusion about our topic today related to the second, third, and fourth speaker. The conclusion of the second presentation is excellent nurses and services for patients undergoing dialysis in the new normal era are the social distancing, isolation precaution, longer waiting time, especially for scheduling, avoiding direct hand contact, frequent hand washing also is advised. The second conclusion for the second presentation. Learning method is a clinical setting in nursing practice education, include that bedside teaching, pre and post conference, case discussion, journal presentation, meet the expert by online or virtual pre and post conference. Delaying some clinical method learning which related with patient in the real time, waiting for the best time to continue our clinical practice, start with the strict requirement, follow the COVID-19 protocol in the hospital. The conclusion of the fourth speaker, the rapid spread of the COVID-19 poses a serious threat to human health, and it is impacting severely on public health, globally communication, and economic system worldwide. Nurses are the key members of the healthcare team charged to control and prevent the spread of the infection disease. Moreover, nurses work as in the front in line, providing direct care to individual infected with COVID-19. Students and educators can help document and analyze the effect of the current changes to learn and apply the new principles and practices to the future. Thank you again to all speakers. See you in the next occasion. Thank you so much. With today's question and answer session ending, I'm handing over the next agenda to MC. Thank you so much.
And also thank you to all of speakers who have given us such wonderful material and insight about how to adapt in medical surgical nursing during pandemic COVID-19.
Terima kasih kepada moderator dan semua pembicara yang telah memberikan kita materi yang sangat luar biasa. tentang bagaimana adaptasi dalam keperawatan medikal bedah di masa pandemi COVID-19 ini.
Ladies and gentlemen, again, let's give a big appreciate to all the speakers.
Para hadirin sekalian, sekali lagi mari berikan apresiasi kepada para pembicara kita.
Ladies and gentlemen, before we begin with our next agenda, we will show you some videos regarding the profile of SRM College of Nursing from India and the 5 nursing academy institutions that present today.
Para hadirin sekalian, sebelum kita memasuki acara selanjutnya, marilah kita bersama-sama menyaksikan beberapa video profil dari SRM College of Nursing India dan institusi-institusi yang bekerja sama dalam acara seminar hari ini.
My Future Life,
where learning comes from more than books. It should be exciting, inspiring.
Where my research can reach out to the international community.
Where I can find any course I want, any knowledge I seek, and any facility I need.
Where I can feel at home in a friendly, supporting environment.
a place with the best professors from around the world.
Where I can prepare to hit the job running.
Where I can chase my dreams.
At the #1 private university in India.
Where the heart does dare to explore, seeking answers from every shore. Where learning goes beyond the book, there the mind knows where to look.
It's there we learn from high and low, fast and slow. From north and south, east and west, that the future's here and now.
Yes, yes, SRM, here we learn and live and lead. Yes, yes, SRM, we shall learn and live and lead.
Enter SRM University, where freedom, empowerment, creativity, and innovation form the cornerstones of the future. A legacy in education that spans over 3 decades of enlightening lives, led by a vision to build a nourishing academic environment for growth, learning, and self-knowledge for tomorrow's generation. Today, SRM University stands at the forefront of India's education revolution, having been placed in Category A by the Ministry of Human Resource Development, Department of Higher Education, Government of India. SRM has been accredited with A grade by NAAC in the year 2013. The various streams of SRM University have been top-ranked by India Today Nielsen Survey 2016. Engineering has been ranked India's #2, factual ranking. Bachelor of Business Administration has been ranked India's #4, factual ranking. Bachelor of Computer Applications has been ranked India's #2, factual ranking. Hotel Management has been ranked India's #4, factual ranking. Engineering in SRM University has been ranked #1 over top 75 private engineering institutions and #2 in engineering among top 150 engineering institutes in India. SRM University is ranked #1 in accordance with region-wise ranking surveys South 2016 for engineering in India by Times Engineering, the Times of India. SRM School of Business Management, Chennai, has been ranked among top 5 private business schools in South India by Times B School, the Times of India. SRM Medical College Hospital and Research Centre, Chennai, has been ranked among top 25 private medical institutes in India by Times Medical 2015, the Times of India. SRM University, Chennai is ranked top in the ranking for top 25 deemed and private universities in India, Survey 2016, for academic excellence, infrastructure facilities, and placements by Higher Education Review HER magazine in India. sprawling campuses of Kattangulattur, Vadapalani, and Ramapuram in the state of Tamil Nadu, and Modi Nagar near Delhi are home to over 67,000 students from around the world. Here, they pursue 206 academic programs in diverse disciplines, be it engineering, medicine, management, or science and humanities. A student universe in itself. SRM University is replete with facilities of every kind a student would need, like the campus Wi-Fi that keeps students and faculty connected wherever they are. Specialized labs with state-of-the-art equipment. Museums and research centers of excellence that guide students' academic research-funded R&D in association with industry, as well as joint research with universities abroad. Digitally enhanced, vast library resources. A high-tech auditorium that seats 4,000 with a 70 mm screen, Dolby Digital Surround, and a 10,000 lumen projector. And highly proficient facilities that open students' eyes to a whole new world of discovery. Students in need of guidance find it by interacting with our faculty who are proficient and helpful. Besides plenty of exposure at international meets, our faculties also include many resident foreign professors drawn from around the globe. The internationally practiced active learning methodology is a salient part of our curriculum. Through it, students at SRM University learn to rely on their own powers of observation and learning by doing. Specially designed kits ensure that the concepts they learn remain evergreen in their minds. Links with over 90 foreign universities greatly enhance our curriculum and provide opportunity for joint research. Through the Semester Abroad program, hundreds of students have studied a semester at top foreign universities like MIT, Carnegie Mellon University, UC Davis, and others. A dedicated international advisory board plays a key role in maintaining these connections. The Engineering Accreditation Commission of ABET, USA has accredited B.Tech in civil engineering, electronics and communication engineering, electrical and electronics engineering, and mechanical engineering programs of SRM University Kattangulattur campus. The Computing Accreditation Commission of ABET, USA has accredited B.Tech in Information Technology program of SRM University Kattangulattur campus. Each and every SRM student is prepared to hit the job running. Our Corporate Advisory Board also plays a key role in the students' training and placements. As a result, a computer science engineering student has been offered 5 million yen to work in Japan. The university has a proven placement record of 343 on-campus recruiters, corporates who look to SRM for promising candidates year after year. Students in need of financial aid can avail of student loans through our associations with nationalized and private banks. Scholarships to the tune of 27.57 crore rupees also gives performance-based assistance to students throughout their academic years. There are so many ways to relax in these campuses, from swimming and horse riding to gym and yoga classes. The choices are simply endless. The 21 men's hostels and 13 women's hostels can accommodate over 10,000 men and 5,000 women with ease. Students can also opt for the international hostel with furnished air-conditioned rooms. Students also have a variety of dining options from the number of canteens, mess halls and food courts that dot the campus to the fine dining restaurants. There are also conveniences around every corner like ATM facilities, the Higginbotham's bookstore, prayer halls and more. When it comes to sports, SRM students are always in the thick of action. Sporting events are promoted throughout the year. Our athletes compete at the highest level and have built a worthy reputation, having won international tournaments. Cultural and co-curricular activities too take place regularly with a spirit of healthy competition. Mingle in a multicultural world with students from around the globe. So, no matter where you are from, you'll find others like you who are ready to catch the future. Enter SRM University, where the future lies.
Yes, yes, SRM, we shall learn and live and lead. We shall learn and live and lead.
Lulusan Akbar Fatmawati Jakarta.
Kompeten, cerdas, profesional.
Selamat datang di Akademi Keperawatan Pelni Jakarta.
tempat kuliah keperawatan terbaik dengan fasilitas dan mutu yang terstandar. Dengan sistem pengajaran yang profesional, Akademi Keperawatan Pelni Jakarta siap menghasilkan tenaga keperawatan yang berkualitas. Berbagai fasilitas telah kami lengkapi sesuai kebutuhan standar akreditasi.
Ayo, kuliah di Arcik.
Yuk kuliah di Akpor RSDB Cikini.
Yuk, kuliah di Arcik.
Such a great videos. Hopefully we always proud of to be nurse.
Video yang sangat luar biasa, semoga kita dapat selalu bangga menjadi perawat.
Ladies and gentlemen, we are going to the next agenda, which is oral presentation session. And the moderator for oral presentation is Nurse Sestramita Eskop. To Nurse Sestramita, please come to join us and I hand over this agenda to you.
Selanjutnya kita akan memasuki acara berikutnya, yaitu sesi oral presentasi. Moderator kita yang akan memimpin oral presentasi ini adalah Nurse Sestramita Eskep. Kepada Nurse Sestramita dipersilahkan.
Thank you for the master ceremony. My name is Estramita from Fatmati Nursing College. Good afternoon. Assalamualaikum warahmatullahi wabarakatuh. May the peace, mercy, blessing of Allah be upon us. Honorable Mr. Professor Regider Third Dioso, PhD, and I think other presenter are, I cannot find it, like Mr. Wantoro, and our dedicated nurses from other hospitals, and the most wonderful, our future nurse from Cikini Nursing College, Pasarebo Nursing College, Fatmawati Nursing College, Pelni Nursing College, and Karis Husada Nursing College. And but not the least, my appreciations for all the hard work, the committee. Thank you for your, and for all, thank you for your precious times you still remain in this webinar. Ladies and gentlemen, before we start the oral presentation, I would like to introduce you to our 7 experts who kindly share their knowledge. That is Nurse Johannes Gamayana, Medical Surgical Nursing Specialist from Cikini Nursing College. Nurse Dewa S. Warsadevi, Medical Surgical Specialist, Fatmawati Nursing College. Nurse Hertuida Clara, Medical Surgical Nursing Specialist from Pasar Rebo Nursing College. Nurse Iga Dewi, Pediatric Nursing Specialist, Pasar Rebo Nursing College. Nurse Fitri Anissa, Pediatric Nursing College from Keris Huzada Nursing College. And Nurse Ayudania Agustin, Pediatric Nursing Specialist from Fatmawati Nursing College. And the last, Nurse Putri Permatasari, Master in Nursing from Pelni Nursing College. And the oral presentation will be present 15 minutes for each presenter. And please kindly, for all the participants, to write down your questions on the chat rooms, and I will choose the best from the best questions, and will be these questions in the last present. And I would like to call upon for Nurse Johannes Gamayana, Medical Surgical Nursing Specialist, with the title Relation Between Patient Perception of Continuous Ambulation Peritoneal Dialysis and the Self-Efficacy in Patient with APD. Time is yours.
Good morning, everybody. First of all, let us praise the presence of Almighty God for His blessings we can gather on this day in His heaven. I want to say thanks to the committee to give me an opportunity to present about my research. Before that, I want to introduce myself. My name is Johannes Gamayana. I am from Academy of Nursing Cikini. My research title is The Relation Between Patient Perception of Continuous Ambulatory Peritoneal Dialysis, CAPD, and Self-Efficacy in Patients with CAPD.
Okay, and subtopic in the presentation are introduction, method, results, discussion, conclusion, and reference. The first, introduction. According to the National Kidney Foundation, Kidney Disease Outcome Quality Initiative, terminal renal failure is a progressive and irreversible decrease in kidney function with a glomerular filtration rate less than 60 ml per minute per 1.73 meter square for more than 3 months, where the body's ability fails to maintain a balance of metabolism, fluids, and electrolytes, which results in the accumulation of urea and other nitrogenous wastes in the blood. Results of basic health research. Riskesdas in 2013 report that the prevalence of terminal renal failure diagnosed by doctor in Indonesia was 0.2%, around 2,000 people per 1 million population. This prevalence increases with age, increases sharply at age 35 until 44 years, 0.3%, followed by age 45 until 54 years, 0.4%, and age 55 until 74 years, 0.5%, and the highest age group, more than 75 years, 0.6%. This data indicate that there is an increasing need for renal replacement therapy with the increasing number of terminal renal failure patients who need serious and effective treatment. Next, the development of renal replacement therapy are currently divided into 3 ways, namely hemodialysis, peritoneal dialysis, and kidney transplantation. CAPD action is one of the options in the renal replacement therapy, which is still newly developing in Indonesia, and not many people know about it compared to hemodialysis action. The results of the study involving 134 hemodialysis patients and 43 peritoneal dialysis patients show that the perception of self-acceptance of the physical health status of hemodialysis patient was better than that of peritoneal dialysis patients, and the self-acceptance of mental health status of peritoneal dialysis patients was better than hemodialysis patients in the first year of undergoing dialysis. Another study involving 240 hemodialysis patients and 54 peritoneal dialysis patients from 14 dialysis centers in Taiwan show that aspect of the quality of life of peritoneal dialysis patients were better than hemodialysis patients, namely in terms of rule function, social function, physical health, mental health, pain complaints, and vitality of patient. Okay, next. Self-efficacy is a person's confidence to be able to perform self-care so that they get the desired results. A person's ability to think, learn from past experience, motivate oneself, and act can influence the formation of self-efficacy. The self-efficacy study of terminal renal failure patients was mostly conducted in patients who underwent hemodialysis than peritoneal dialysis. Based on the above phenomena, the researcher is interested in knowing the relation between the patient's perception of the condition of the disease and the selected treatment, dialysis action, with his ability to believe, self-efficacy, to carry out the CAPD dialysis procedure appropriately. Okay, next, how the research method and data analysis. The study used a cross-sectional approach. The number of samples of 75 respondents was selected by consecutive sampling technique. The variable measured in the study were age, gender, education level, length of time undergoing CAPD, social support, depressions, perception of CAPD, and self-efficacy. And then the research data were analyzed using univariate, bivariate, and multivariate variables for age, gender, education level, length of time undergoing CAPD, social support, depression, perception of CAPD, and self-efficacy of undergoing CAPD. Bivariate analysis using chi-square test and multivariate analysis using logistic regression test. Okay, we go to the research results. Table 1 show that most respondents who undergoing CAPD are adults 26 until 45 years, as many as 40 respondents, 53.3%. Male gender, as many as 57 respondents, 76%, and have a low level of education, as many as 51 respondents, 68%. Table 2 show that most of the respondents, 53.3%, had been undergoing CAPD for a long time. Besides that, most of the respondents received good social support, as many as 41 respondents, 54.7%. The majority of respondents experienced depression, as many as 50 respondents, 66.7%, had a good perception of CAPD as many as 61 respondents, 81.3%, and had less self-efficacy when undergoing CAPD as many as 41 respondents, 54.7%. Table T results of the analysis of the relation between age, gender, education level, and length of living with CAPD with respondent self-efficacy in undergoing CAPD. Table 3 shows the results of statistical tests explaining that there is no relation between age and self-efficacy of undergoing CAPD. There is no relation between gender and self-efficacy. No, there is a relation between education level and self-efficacy, and there is no relation between the length of undergoing CAPD and self-efficacy. Next, Table 4 show the results of statistical tests that there is a relation between social support and self-efficacy. Based on value odds ratio, it can be concluded that respondents who get good social support have a 0.580 times chance of showing good self-efficacy compared to respondents who don't get social support. Table 5 shows that the majority of respondents who did not experience depression had good self-efficacy, while the majority of respondents who experienced depression had less self-efficacy in undergoing CAPD measures. The results of statistical tests show that there was no relation between depression level and self-efficacy. Okay, next. Table 6 shows the majority of respondents whose perception of CAPD lacked good self-efficacy, while respondents whose perception of CAPD were good had less self-efficacy in undergoing CAPD actions. The results of statistical tests show that there was a relation between perception of CAPD and self-efficacy. Based on the odds ratio value, it can be concluded that respondents with good perception of CAPD have a 0.259 chance of showing good self-efficacy compared to respondents whose perception of CAPD are less. Table 7 show two variables that have a significant relation with self-efficacy, namely patient perception of CAPD and social support. The depression variable was still included in the model because depression was considered substantially important and had an effect on self-efficacy. Based on Table 5.8, it can be seen that there is a relation between patient perception of CAPD with the self-efficacy of respondents undergoing CAPD, and there is a relation between social support and self-efficacy of respondents undergoing CAPD. Next, discussion: relation between age and self-efficacy. The results of the research analysis show that there was no significant relation between the age of the respondent and the self-efficacy of undergoing CAPD, so that regardless of the age of terminal renal failure patients who underwent CAPD, it would not affect the patient level of self-efficacy while undergoing CAPD. The results of this study are the same as the research conducted on terminal renal failure patients who underwent hemodialysis in terms of the relation between demographic characteristics, namely the age of the respondents in the range of 40 until 50 years and the compliance of respondents in carrying out hemodialysis measures. Relation between gender and self-efficacy. The results also show no significant relation between gender and self-efficacy of undergoing CAPD. This is different from the results of a study on terminal renal failure patient undergoing hemodialysis, which state that self-efficacy was related to and influenced by the patient gender and physical condition. In the study, it was found that the self-efficacy in male patients was higher than that of women. Relation of education with self-efficacy. The results also show that there was no significant relation between education level and self-efficacy of undergoing CAPD. This is in contrast to research on the influence of culture on no compliance with treatment, which show the level of education a person has in deciding whether to seek treatment or not. Patients with higher education tend to be more active in seeking health information, visiting healthcare places for treatment, and are more adherent to undergoing medical procedure than patients with low education. Relation between the length of time underwent CAPD and the self-efficacy of patient undergoing CAPD. The results also show that there was no relation between length of undergoing CAPD and self-efficacy of undergoing CAPD. This is different from Bandura theory, which states that the longer a person takes or performs an action based on the learning process from personal experience and the experience of others, the more trained and confident a person will be to carry out an action. Relation of social support with self-efficacy. The results show a relation between social support and self-efficacy of patients undergoing CAPD. The results of this study are the same as those of the relation between self-efficacy and social support from dialysis service centers in Greece. So that self-efficacy has a positive and significant relation with support from dialysis patient care centers. Okay, next, relation between depression and self-efficacy. The results also show no relation between depression level and self-efficacy of patients undergoing CAPD. This is different from studies to determine the effect of self-efficacy on physiological factors in kidney transplant patients and hemodialysis. The results show that the level of depression had a relation with the patient's ability to self-efficacy, where patients who had high levels of depression had low self-efficacy. The relation between perception and self-efficacy. The results show a significant relation between patient perception of CAPD and self-efficacy of undergoing CAPD. This is consistent with the perception of renal failure patients about the use of kidney replacement therapy that has been done in Japan. This study involved 437 patients who chose hemodialysis from the start and 70 patients who chose CAPD from the start. The results show that the patient was happy and satisfied with its choice of modality chosen. Hemodialysis patients are satisfied to choose hemodialysis modality, whereas peritoneal dialysis patients are also satisfied with their choice of choosing peritoneal dialysis. Okay, conclusion. My research, there is a significant relation between patient perception of CAPD and patient self-efficacy of undergoing CAPD. Recommendation: nurses need to improve the assessment process in exploring the patient view or perception of CAPD action and the patient ability while undergoing CAPD patient self-efficacy, including psychological condition in the form of social support and the level of depression experienced by the patient. Second, nurses need to involve the role of social support from both the healthcare team, family members, and relatives of the patient in an effort to prepare patient before, during, and after undergoing CAPD action.
These are some of the reference I use. Thank you very much for your attention. Good morning and success for all.
Thank you very much, Nurse Johannes. Very interesting and fruitful research. And for the second, I would like to remind again, thank you very much for all the participants for your times. There will be open question that you can write down on the room chat, and I will ask it in the last presenter later on. And for our next oral presentation will be Nurse Hertoida Clara, Medical Surgical Nursing Specialist, with the relationship between duration of diabetes and diabetes self-management behaviors. Again, time is yours.
Ladies and gentlemen, first I would like to thank you for listening my presentation. My name is Clara. I work at Nursing Academy of Pasar Rebo. I will present my research with the title The Relationship Between Duration of Diabetes and Diabetes Self-Management Behaviors. Diabetes is a global burden. The International Diabetes Federation reports that 415 million people have diabetes today, and is predicted to increase to 640 million by 2040. We also know that the complications of diabetes are very complex because they include micro and macrovascular complications that can cause damage to various organs. Therefore, it is necessary to do best self-management in dealing with diabetes. There are many factors that can relate it to or influence diabetes self-management behavior, including duration of diabetes, knowledge, self-efficacy, and also other factors. I have studied these three factors, but at this time, I will present the results of my research for the first factor, that is the duration of diabetes. So the purpose of this research is to identify the relationship between duration of diabetes and self-management behaviors of people with type 2 diabetes with method cross-sectional research design involve 112 people with type 2 diabetes. And the questionnaire used in this study is the Summary Diabetes Self-Care Activity or SDSCA and Socio-Demographic Questionnaire. And the results of my research in first table, it can be seen that the average diabetes duration of the respondent is 8.2 years. The shortest is 1 year and the longest is 30 years with a standard deviation of 6.4 years. In table 2, we can see the result of bivariate analysis, association between duration of diabetes and self-management behaviors of people with type 2 diabetes. These results indicate that there is a significant relationship between duration of diabetes of people with diabetes mellitus and their self-management behaviors. The relationship between these two variables is positive, which means that the longer the respondent has diabetes, the more their self-management behaviors increases. I had found 3 researchers that gave the same result regarding my research. They are Etwan and Najar, Yin, and C et al. Etwan and Najar have 178 samples. They did research at Amman, Jordan in 2013, and Yin with 201 samples. She did research at Beijing in 2005. And she et al. With 148 samples, they did research in China in 2020. The results of this study are in line with the results of research by Atwan and Najar, Yin, which also showed a significant relationship between diabetes duration of people with diabetes and diabetes self-management behaviors. Similar results are also shown by research C et al. In 2020, where adherence to self-management is influenced by the diabetes duration of people with diabetes. So the results show a significant relationship. It's possible because they had more regularly attended clinics for follow-up consultations. We infer that more follow-up visits with physicians may enable patients to gain more knowledge about their disease and health condition, and thus increase their motivation to perform self-management. In addition, people who have had diabetes for a long time may have adapted better to their disease and not be too resistant if they are advised to integrate healthy lifestyle changes. Bandura also suggests that people who have long had diabetes have more experience with self-management. Evidenced by the respondents studied, those who did self-management for more than 5 days were respondents who had diabetes for more than 20 years. So, the conclusion is the results obtained indicated that there was a relationship between duration of diabetes and self-management behaviors of people with type 2 diabetes. It is possibly because they had more regularly attended clinics for follow-up consultation. So they have more knowledge and motivation to perform self-management. And here my reference. So thank you for listening me, and back to moderator.
Thank you, Madam Clara. It's very wonderful presentation. And I would like to remind once more, because there is still no question from both presenter, you can allow and feel free to ask in Indonesia. And would you mind to write down on the chat room, please? And for our others presenter, the third presenter is Nurse Dewa S. Swasadewi, Medical Surgical Nursing Specialist, with the title Benefit of Intradialytic Exercise to Increase Muscle Strength and Reduce Muscle Mass Loss on Patient CRV on Dialysis article review. Times is yours.
Okay, good afternoon, ladies and gentlemen, honorable all speaker and honorables, all leader of the 5 institution, and dear all students. I would like to again introduce myself. My name is Swarsa Dewi from Academy of Nursing Fatmawati. Now I would like to present about benefit of interdialectic exercise to increase muscle strength and reduce muscle mass loss on patient chronic renal failure undergoing hemodialysis. Article review. Next. Okay, talking about renal failure and exercise intradialysis. We have to 4 keyword remember, significant to remember. One, chronic renal failure. Chronic renal failures, global public health, over 750 million persons worldwide. The prevalence of chronic renal failure among United States adults is estimated at 15%, indicating that over 30 million American adults may have chronic renal failure, according Service and Service 2019. The population is growing rapidly in the coming years. Several countries expanding access to hemodialysis, according to 2015. At least 2.9 million people need dialysis in Asia. This is a gap in availability of dialysis, only 66%. Introduction. A recent study highlights that manifestation of impaired comfort can be identified. This manifestation, discomfort sensation, inability to relax, restlessness, irritability, fear, pruritus, cold sensation, symptom of suffering, and so on. Role of nurses mediate aspects that have influence on the establishment of the patient health, the development of activity, improve their comfort. According Milo et al., 2019. Now, hemodialysis, one of the replacement therapy in chronic renal failure. Intradialytic patient, it's meaning chronic renal patient undergoing hemodialysis. In the past decades, patient undergoing maintenance dialysis globally has increased dramatically. In 2010, patient on dialysis was estimated more than 2 million worldwide. Modeling data suggests this number will be more than double by 2030. Several factors contributed The increases number of dialysis, first, increase of chronic renal failure cases, broadening of kidney replacement therapy acceptance, greater access to maintenance dialysis low and middle income country. Hemodialysis therapy, it's carried out semipolar or supine sitting position from 3 to 6 hours per visit with little or no physical activity. Pain due to muscle cramp is common complication during hemodialysis, according to Samsari 2019. Presence of dialysis access and dietary restriction also reduce physical activities in intradialytic patients. Regular activity, more than 3 hours daily, a strong determinant of further needed hospitalized specialized care and prevalence of other comorbidities. Hemodialysis therapy, the change of patient behavior contribute to decrease muscle mass, physical function, and mobility of upper and lower extremity. Studies show that exercise can reduce pain and fatigue to reduction of muscle stiffness and sensitivity and improve blood flow. Individual less activity and low motivation, especially intrinsic motivation, has been identified as a major either prescribing exercise. Prolonged exposure to hemodialysis therapy has catabolic effect on muscle, also expenditure, muscle loss associated decreased quality of life. Next. Routine exercise program is promoted for healthy people. Chronic renal failure patients on hemodialysis usually don't do routine exercise. Intradialytic exercise increase blood flow, circulation, and glomerular filtration rate to reach hemodialysis adequacy. Purpose of this review to investigate the benefit of intradialytic exercise program, outcome specifically on strength and physical function. Several studies, multiple benefit intradialytic exercise on chronic renal failure patients have been in this some study. Regarding of Dong, Chang, and Yin, have research about benefit of exercise intradialytic difference with patient chronic renal failure. Escaldo et al. International physical activity according to the evaluation with sitting, walking, and cycling, running. Other studies, strength physical exercise, new therapeutic, reduce complication in renal failure patient, and effective intradialytic strength physical. The physical activity program for hemodialysis patient is aiming for improvement physical fitness, achieve a patient, and increase social integration as well as improve the quality of life. Physical activity program must include activity leading flexible maintenance and muscle strength, avoid disbalance, improvement the muscle coordination and respiratory function. Other benefits of physical activity like improvement of the level independence, better dealing with chronic disease require treatment. This is the length of hospitalized and mortality. Regarding Jaco et al., to minimize this negative effect, the implemented specific exercise program during dialysis, strong leg, and resistance training is considered as effective to increase the muscle strength. Regarding Qi and Chan et al., this study is to analyze the effect of intradialytic resistance training, the patient lower extremity muscle function. Current recommendation to prevent and manage aging relation even the maintenance hemodialysis, including provision, nutrition, intake, and regular exercise. Despite recommendation for exercise-based rehabilitation, patient implementation rehabilitation program standard treatment modality is limited method. We're using the method by searching PubMed, Request, and Medline International Journal, or just from December 2019 to August 2020 to restricted intervention intradialytic exercise program. Studies included following criteria: investigate intradialytic exercise by randomized control trial and original study design. 3. Chronic renal failure patient following hemodialysis. Text article was available in English. Predetermined inclusion using criteria inclusion exclusion. Next. Because its main population, we chose adult chronic renal failure patient on hemodialysis at least 4 months. Intervention, using intervention in intradialytic exercise 2 hours after starting hemodialysis by aerobic stretching, isotonist, and pedal for 30 minutes. Comparison, the result is comparison between pre and post intervention. And outcome, intervention group, we found that increased muscle strength, reduced muscle cramp, and control group is none. Study type, outpatient intervention. The result by 10 studies were included in this review. Most studies focused intradialytic exercise program. This program seemed increased muscle strength, improve physical function, less decline muscle cramp and muscle mass. Chronic renal patient on hemodialysis problem were influenced, decreased function, less physical activity during hemodialysis. This significant study, among the many reasons for low level of physical activity and chronic renal failure on hemodialysis. 3 factors contribute most. 1, reduced muscle strength caused by muscle catabolism and wasting. 2, increased cardiovascular risk in combination with high prevalence of comorbid disorder, both leading to reduced health-related quality of life, with its impairing physical activity with subsequently. Patient chronic renal failure impairment muscle strength. Its hemodialysis treatment contribute to loss of amino acid. Conclusion, intradialytic exercise and rehabilitation program for about 30-minute session per week, low, middle, and high intradialytic exercise. In addition, standardization of intradialytic exercise program evaluated for patients with chronic renal failure hemodialysis on muscle strength, muscle stem, and muscle mass physical function is needed for further. The resistant exercise will improve the muscle activity, minimize complication risk. Okay, patient with chronic renal failure on hemodialysis need to intradialytic exercise program, low, middle, or high exercise. In addition, standardized intradialytic exercise program outcome evaluation for patients with chronic renal failure on hemodialysis, especially on muscle strength, muscle mass, and physical function is needed for further study. Okay, this is a patient chronic renal failure ongoing hemodialysis. In two patients in different line. One of that using femoral line in the men people, and then the other ladies using the catheter double lumen in the subclavian vein. Okay. This is patient with the other patient with a line in the shunt in her hand, and then both of extremity starting for exercise. Okay, this is simple exercise, low impact. It's meaning this low exercise using the abduction, and flexi extension combined. Okay, this is stretching. Stretching exercise is very simple one. Stretching and flexing. This is flexion extension, and the other with flexi and extension knee, and the other with flexion and extension. Okay. Okay, this is my reference, a lot of reference. Okay, for conclusion, all of patients with chronic renal failure on hemodialysis, it's a very necessary to do exercise to increase her muscle strength and prevent to reduce muscle mass. Why? Because a patient with chronic renal failure restricted nutrient and reduce the mineral bone density, and for a long time the muscle mass will be loose. Okay, thank you very much.
Thank you very much for Nurse Dewa Swasta Dewi. Very fruitful sharing. And for the next, I would like to call again for all participants. Please feel free to use Indonesian or English to ask for every oral presentations. And for our next presenter, Nurse Iga Dewi, Pediatric Nursing Specialist with the Quality of Life in Children with the Chronic Kidney Disease undergoing renal replacement therapy as a review. Time is yours.
you, Ms. Sastra. Good afternoon, ladies and gentlemen. Let me introduce myself. My name is Iga Dewi Purnamawati. I am from Nursing Academy Pasar Rebo. I will present the result of my research of review article entitled Quality of Life in Children with Chronic Kidney Disease Undergoing Renal Replacement Therapy. Background: I am interested in review article on the quality of life in children with CKD, including the increased incidence of CKD in children seen in several countries. CKD in United States in 2015 amounted to 1,319 children, and the number increased to 9,800. In 2017, the figure increased 7 times from 2015. An incident in Europe around 11 to 12 cases per 1 million children per year, with prevalence approximately 50 to 60 cases per 1 million children. In Indonesia, country, based on national data from CKD have not been found in Indonesia, but based on data from 14 hospitals in Indonesia, it was found that 212 children experience CKD and undergoing replacement therapy with mortality rate of 23.6%. Chronic kidney disease refers to a condition related to irreversible kidney damage that can further progress to end-stage renal disease. End-stage renal disease severely affects the quality of life in children. What is quality of life? According to WHO definition, quality of life as individual perception of their position in life in the context of the culture and value system in which they live in relation to goal, expectation, standard, and concern. To be able to survive in SRD, renal replacement therapy is needed. What renal replacement therapy is performed include hemodialysis, peritoneal dialysis, and renal transplantasi. To purpose of literature, to identify in the literature study that evaluates the quality of life in children with CKD undergoing renal replacement therapy and validasi instrument in pediatric. Method: this research as systematic literature review method, systematic review of the literature with search conduct in the following database: Medline, PubMed, ProQuest, Chinal, and Cochrane Library database, where search for from the 2010 to 2020 in quality of life in children with CKD undergoing replacement therapy. The following 8 articles and conduct research related quality of life in children with CKD using the method of research, a cross-sectional study, and participant age 2 years to 25 years. One of the instruments used to measure the quality of life of children is the Kids Screen 5-2. The questionnaire is also categorized into 10 dimensions, including physical well-being, psychological well-being, mood and emotional, self-perception, autonomy, parent relation, and home life. Financial resources, fear and social support, school environment, and bullying. This egg article, literature search, found on 191 article in which only 8 article were included in the inclusion criteria of the egg article instrument used to measure the quality of life in children. On them is the kids screen 52, pediatric QL, KIN, ya, KINDL dan pediatric QL, and the kids scope. This review result, one, physical well-being of study children was significant lower compared to control group. Two, the HRQL was lower in most domain in the HD group compared with the PD group. 3. The mean HRQL score of the children with ESRD on dialysis were significantly lower for both child. 4. QOL is very influenced by the age of experienced illness, so that the quality of life children varies widely. 5. Children has the positive perception of quality of life. The self-esteem dimension was the best perceived view, and emotional well-being dimension was the worst perceived. 6. The CAPD group had a higher mean score of quality of life in all domains, include somatic symptom, emotional symptom, and social function. Conclusion in literature review, conclusive quality of life in children with various QL instruments from 8 articles conclude that QL is better in children who have undergoing kidney transplantation. Compared to children with PD and HD, QL of children with PD was better than children with HD in all domains. Reference. Thank you. Back to moderator.
Thank you, Nurse Iga. It's very fruitful sharing. And from the chat, I can just only see only one question for Mr. Johannes. I hope you still remain there because I think around 14 candidates still in the web. I know maybe one of you is still praying or for lunch, but I would like to open the question for the rest of the 7 questions. Please do not hesitate to write down in the chat room, please. And for our next presenter, this will be Nurse Fitri Anissa, pediatric nursing specialized with the overweight and obesity children in private elementary school of South Jakarta. Time is yours.
Okay, thank you, moderator, for having me. Good afternoon, ladies and gentlemen. I am Fitri from Krisusada Nursing Academy. I would like to present my research. The title is Overweight and Obesity Children in Private Elementary School of South Jakarta. Okay, this is the outline of my presentation today. First, we will talk about the background of the study, and then I will share about how I did my study, which is described in method. And then we will see the result. And the last is discussion, and conclusion. Okay, this is the background of study. In Indonesia, the prevalence of overweight and obesity in school-age children shows a significant increase. Well, actually, it is not only Indonesia, but many countries also face this problem. Obesity at school age has associations with various health problems, both physical problems and psychosocial problems. In physical problems, for example, diabetes type 2, cardiovascular disease, and the psychosocial problems like depression and anxiety. Well, in several studies, it is stated that the prevalence of overweight and obesity is more prevalent in private school. So based on those data, based on those facts, I think that we need to know the amount of overweight and obesity in private schools for developing good strategies to prevent overweight and obesity in school-age children. So the aim of this study is to know the proportion or the amount of overweight and obesity in private elementary students in South Jakarta. So these are the method of my study. So my study is cross-sectional design. I use 400 samples. Well, the samples were taken by multi-stage sampling with several steps of grouping. And the nutritional status I use with WHO Z-score graphic. It is by weight per height. And the inclusion criteria of my study is children aged 6 to 12 years old, and they didn't have any chronic metabolic disease, and they didn't take any medication that causes weight gain. So these are the results, yeah. This is the distribution of respondents based on gender. The chart tells us that there were slightly more male respondents than female respondent. The male respondent is 52%. Yes, from this table, we can see that most respondents were 7 years old. And from here, we can see that there are more children with normal nutritional status. But however, if we look a little bit closer, if we look a little bit carefully, we can merge the group of overweight and obesity. Then we will find that the group with nutritional status above normal is more numerous than normal nutritional status. And this table is nutritional status based on gender. We can see that from this table, the gender group with higher number of overweight and obesity, with overweight and obesity is the male group, yeah, the boy group. Okay. The proportion of overweight and obesity in private school is associated with socioeconomic status and lifestyle. Some of lifestyle related to over nutritional status and obesity include decreased physical activity, increased consumption of junk food like KFC or McDonald's, include and easy access to transportation from home to school. Well, actually, they usually use shuttle bus or Gojek, yeah, online motorcycle taxi. The cause of overweight and obesity in children is due to the consumption of calories that are more than the child's body need. Many types of foods high in fat, salt, and sugar are loved by children. Well, actually, those kind of food not only loved by children, but by all of us. Yeah. In addition, children usually imitate the food portions of their parent and or adult family member at home. In fact, the food portion for adults and children are not the same. Excess eating portions accompanied by minimal physical activity is one of the causes of obesity. And also lack of sleep is assumed to contribute in obesity in children. Children who slept less at night also had higher levels of the hormone that responsible for fat storage in the body. Well, researchers related to the management of overweight and obesity in school-age children have been developed in advance in developed countries. For example, in United States, it is stated that school-based intervention has significant level of effectiveness in preventing obesity in school-age children. School-based intervention programs include components of routine assessment, measurement, and documentation of students' nutritional status, as well as serving healthy foods and increasing physical activities according to age. So this is the conclusion of study. Well, I think that different strategic plan is needed to decrease the number of overweight and obesity prevalence in elementary school students in South Jakarta, especially in private school. Periodical screening of nutritional status and counseling, both for students and parents, are essential for this program. This strategy also needs to involve school health unit to educate students and teachers regarding the risk of childhood overweight and obesity, especially to implement in private school. Well, that's it, my presentation, my sharing. Thank you for the attention. I will give it back to the moderator. Thank you.
Thank you for Nurse Fitrianisa. Very wonderful presentation. And there is still remain one question only on the chat. Please, for the participant, do not feel hesitated to use Indonesian or English to ask the question for the presenter. And our next oral presenter is Nurse Ayudania Agustin, nursing pediatric specialized with the kangaroo mother care or KMC intervention to improve breast milk production. Time is yours.
Okay, hello everybody. How are you today? I hope you are still spirit. Assalamualaikum warahmatullahi wabarakatuh. My name is Ayudania Agustina. I'm from Fatmawati Nursing Academy, and now I want to share to you about my study and my study about kangaroo mother care. Do you know kangaroo mother care? Okay. The title of this presentation is Can the Kangaroo Mother Care or KMC Intervention Improve Breast Milk Production? And the outline in this presentation are introduction, method, result, and discussion, conclusion, and Thanksgiving and references. In introduction, as we know, babies born with low birth weight and premature have health problems, and it makes them hospitalized. Babies who are hospitalized can be one of the factors causing stress for mothers because they have to be temporarily separated from the baby. And stress in mothers with this condition can be affect breast milk production. Meanwhile, breast milk is very necessary for optimal baby growth and development. Health workers who care low birth weight and premature babies also need to think about this condition because it is closely related to the smooth release of breast milk, so that the intervention are needed that can be used to prevent anxiety and stress on the mother while the baby is hospitalized. Nurses can assist mothers in improving maternal coping while the baby is cared for and increasing the mother's confidence in adequate breastfeeding. The success of breastfeeding doesn't only from baby or from mother, but the success of breastfeeding involves both mother and baby. And then some intervention for improved secretion of oxytocin and prolactin in mother are consumption of long bean leaf, and then oxytocin massage, and then acupuncture, early initiation of breastfeeding, and others. So what have health workers been doing to facilitate the problem of inadequate milk production in mothers? Researchers think babies cannot be separated from the family. Nursing care for low birth weight and preterm baby are provided with a family center care. So that I chose the intervention is KMC or kangaroo mother care to improve breast milk production. The purpose of the study is identify the effect of the implementation of kangaroo mother care or KMC on increased milk production as long as the baby was hospitalized. And the design of this study is qualitative with multiple case design involved 3 selected cases who according to the inclusion criteria. And this is inclusion criteria for mother and for baby. Inclusion criteria for mother are the place where the mother lives is close to the hospital and then has desire to breastfeed and give breast milk and then has desire to do KMC, doesn't take drugs, doesn't have dangerous disease such as HIV AIDS, tuberculosis, cancer, abscess, breast, postpartum depression, and then have problem nursing insufficient milk production. And inclusion criteria for baby are psychological function is stable, and then have minimum body weight is 900 grams, and then gestational age 28 until 33 week, and then long hospitalized time after birth, and then get permission from doctor to give KIMC, and doesn't have congenital abnormality such as umbilical, meningocele, and hydrocephalus, and no central venous catheter in the shoulder or umbilical catheter. And the operational process in this research are step 1, researcher arranging research permit at hospital in RSUPN Cipto Mangunkusumo and in RSAB Harapan Kita. And then step 2, taking care of research ethic in hospital and then select participant according to inclusion criteria. And then in the first day, researcher do assessment and then give education and facilitate implementation of KMC by mother. And then the second day until fourth day, facilitate implementation of KMC by mother, and then measure and record milk production. And duration every KMC is 120 minutes. And how the result in this study? I have 3 different cases. In case 1, premature baby, baby O quintuplet atau kembar 5, and then mother's breast milk production is 230 until 250 milli per day. And then case 2, baby with hyperbilirubinemia and breast milk production 30 milli per day. And then case 3, baby girl with sepsis, breast milk production 25 until 70 milli per day. And this is mother characteristic, Mrs. L, 32 years old, and then bachelor, last education is bachelor, she is employee, and then Mrs. Yeje, 28 years old, and then last education high school, and she is housewife. And Mrs. AN, 27 years old, last education high school, job, she is housewife too. And this is the table of show frequency of kangaroo mother care per a day. Mrs. L do KMC 3 until 4 times per day, And then Mrs. Yeje do KMC 1 until 2 times per day. And then Mrs. AN do KMC 2 until 3 times per day. Okay, and since the first day until the fourth day, mother's breast milk production looks like picture. In Mrs. L, the average of increased breast milk production is 43.3 milli per day, and then in Mrs. YJ is 16.6 milli per day, and then Mrs. AN is 31 milli per day. And now we discussion production of breast milk in 3 mothers is inadequate for the baby's need, especially for babies born underweight or premature who need adequate fluid intake to pursue optimal growth. According to Rahayu, that the production and release of breast milk occurs after the baby is born, which is followed by a decrease in estrogen level, which encourage an increase in prolactin level for milk production. Based on the recognition of the 3 mothers, it appears that frequent of KMC can help mothers feel comfortable, relaxed, and calm, so that the release of the hormone oxytocin runs smoothly and has an effect on increasing milk production. And according to Flecking, Ewald, and Wallin, showing that KMC can help the process of breastfeeding babies and have the effect of increasing milk production. According by Ranford, at the time of KMC, skin-to-skin contact between mother and baby is a stimulus that will be carried to the brain. Furthermore, this stimulus will trigger the release of oxytocin, which will have a positive impact on mother's emotional and subsequent milk production and the process of breastfeeding the baby. According to research by Akuna Muga et al., the level of breast milk secretion during and after KMC found that the volume of breast milk was higher in mothers during KMC than in mothers without KMC intervention. And according to Wilson, introduce this intervention is an effective strategy for increasing the amount of mother's milk production. In this study, mothers reported that when the touching baby and then touches is seen as stimulating milk production and has a significant impact on the process of milk transfer and milk production. Some mothers even report that KMC increases the amount of milk in their breasts. The conclusion of this study is kangaroo mother care can be an intervention option for mothers who have breast milk production problems. While in the hospital, nurses should provide clear and structured health education and assistance so that the goals of providing kangaroo mother care intervention are achieved. This intervention can also be given to infants who are treated with CPAP. And then Thanksgiving for Honorable Director of RSUPN Cipto Mangunkusumo and RSAB Harapan Kita for Head of Perinatology and Neonatal Intensive Care Unit and all nursing staff and doctor who have helped me, and then for mothers and baby who have participated in the research, and then for Ministry of Research and Higher Education Republic Indonesia. And this is references I use. Thanks for attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you for the sharing of the fruitful knowledge and research of Nurse Ayuda. And our last presenter, and I would like to remind again, there is only a few questions for Mr. Yohanes, Nurse DWS Swasa Dewi, Nurse Iga Dewi, and Nurse Ayuda. Feel free to ask the questions. For other participants to write down the question, please. And for our next agenda is our last and the best presenter, Nurse Putri Sari, Master in Nursing, with the effectiveness of pressure at DGPT 21 acupressure point on the breast milk production in the patient post-section cesarean. Time is yours.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. Thank you for the opportunity given to me for the oral presentation at the international seminar this afternoon. Ladies and gentlemen who attended the international on the seminar this afternoon, I am Putri Permatasari, Master of Nursing from the Akbar Pelni, Jakarta. Today I am going to talk the effectiveness of pressure at the GB21 acupressure point on breast milk production in patient post-sexual cesarean. And then I have divided my talk into 5 parts. First part is background, and then second part is purposes, and third part is result, and 4 is discussion, and then last one, suggestion and conclusion. My talk will take about 10 minutes. Now let's move on. The first part my talk with is background. The neonatal mortality rate was found to be 15 per 1,000 live birth. The infant mortality rate is 24 deaths per 1,000 live birth. The most common causes of infant mortality were diarrhea, 31.4%, and pneumonia, 23.8%. The high rate of infant mortality can be overcome by meeting adequate nutrition and nutrients through breastfeeding. And then the pressure on the Jianjing GB21 point acupressure is one part of the acupressure point technique for lactation using the traditional Chinese medicine approach, providing comfort to postpartum patients by giving acupressure method to specific point on the body to increase milk production and patient comfort. Next, let's move on the second part. My talk with is purposes. The effectiveness of pressure at GB21 acupressure point on breast milk production in post-cesarean women. This is the part research concept framework. First one, input, postpartum sexual cesarean. And then characteristics of postpartum cesarean are age, study, religion, profession, and tribe. And then we go to the process, pressure at acupressure point GB21. And the output, breast milk production in the postpartum sexual cesarean. The next part, talk hypothesis. The first, there is no effect of the effectiveness of pressure at the acupressure point GB21 on breast milk production in post-cesarean women. And the second one, there is an effect of the effectiveness of pressure at the acupressure point GB21 on breast milk production in post-cesarean women. Next part, research design, quasi-experimental and one group pre-post test design. Subject, patient, post-sexual cesarean. The first step is pre-observation respondent post-sexual cesarean using the observation sheet. The second step is treatment acupressure GB21. And then finally step Post-observation, respondent post-sexual cesarean using the observation sheet. Next, population and samples. The population in this study were post-sexual cesarean mothers at the Regional Hospital of Central Sulawesi Province. And then the sample size is calculated by using the federal formula to prevent dropout of missing samples. One sample was added, so the total sample is 17. And these are inclusion criteria. First one, mother post-sexual cesarean. Second one, willing to take part in research. And third one, infant were not given formula milk during data collection. Fourth, healthy baby. And last one is roaming in. And then exclusion criteria is during the intervention period, the client did not obey the process of giving the intervention. The next part attack univariate analysis, distribution of respondent based on characteristic respondent at the Regional Hospital of Central Sulawesi Province, about sample 17. Variable age, education, religion, profession, suku. And then based on the table above, it is known that the majority of respondents are 21 to 35 years old. The majority of respondent education is higher education. The majority of respondent religion are Islam. The majority of respondent jobs are not working. And then the majority of respondent ethnic is Saluan. And then bivariate analysis. So that in the group of post-sexual cesarean women who were given pressure intervention at the acupressure point GB21, there was an increase in milk production from the indicator of the mother before and after the intervention. The difference between before and after the intervention was 1.59. The 59, the statistical test result obtained p-value about 0.000, less 0.05. This means that there is a difference between breast milk production from maternal indicators before and after pressure intervention is given at the acupressure point GB21. And then it saw that in the group of post-sexual cesarean, mothers who were given pressure intervention at the acupressure point GB21, there was an increase in milk production from the indicator of the baby before and after the intervention was given. The difference between before and after the intervention was 1.47. The statistical test result obtained p-value about 0.00, less 0.05. This means that there is a difference between the milk production of the infant indicator before and after being given pressure intervention at the acupressure point GB21. In this research, patient post-sexual cesarean is respondent and characteristic age, study, religion, work, tribe. And majority characteristic in research study age 21 to 35 and study had higher education, religion, Islam, and unemployed and Saluan ethnic. This research treatment acupressure point GB21 when the mother stands in will suppress the work function of the hypothalamus so that inhibits the secretion of the hormone prolactin and oxytocin by the pituitary gland, so that message is carried or to produce oxytocin and reduce stress about cortisol, and provide a relaxing effect on tense muscle and increase blood flow. And then tactile stimulation that is felt when given a message will cause an increase in corticotropin secretion, which can reduce level of the hormone cortisol, so that the mother relax and thus stimulates the production of the hormone prolactin and oxytocin, so that the hormone increase and increase in milk production. Let's move on result. The majority of respondents were at 21 to 35 and had higher education, religion, Islam, unemployment, and Salwan ethnic. And then pressure at acupressure point of GB21 is more effective for increasing milk production in post-sexual cesarean mothers than maternal indicator, as evidenced by the result on the p-value 0.000. And then on the indicator of baby pressure at the acupressure point GB21 is more effective for increasing milk production in post-sexual cesarean mothers, as evidenced by the result of the p-value 0.000. I would like to end my presentation suggestion and conclusion. Suggestion for healthcare institution can help facilitate nurses to develop themselves in order to increase knowledge about the benefit of non-pharmacological pressure therapy at the acupressure point GB21 in post-sexual cesarean mothers. Then it's also necessary to carry out further research by adding new variables related to non-pharmacological therapy and pressure at the acupressure point GB21 to increase milk production, especially in post-sexual cesarean mothers. And then this is my documentation is research at Hospital Central Sulawesi Province. And that's all I want to say for now one. And then thank you. That's all I can say more and less. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you for the presentations, Nurse Fitri. And now we are come to the last part, where is the discussions session. I have written down a few questions from the participants, and I would like to asking regarding to Nurse Johannes Gamayana. Are you there, Mr. Johannes?
Oke.
Mr. Johannes?
Ya, Ibu Sestramita.
Okay, I'll just go to the next question, or just Mr. Johannes?
Ya, oke.
Are you there? All right. Okay, Mr. Johannes, there is one question for you from the Siti Sundari, very active student from Akbar Pelni, Jakarta. And the question is, what is the CAPD therapy can apply in the CKD patient with the complication of diabetes mellitus and hernia? Time is yours, please.
Oke, baik. Saya akan menjawab pertanyaan dari Saudari Siti Sundari ya, dari Akbar Pelni. Sebelumnya terima kasih Ibu Sestramita. Baik, pertanyaannya kurang lebih, apakah terapi CAPD dapat diaplikasikan pada pasien CKD dengan komplikasi diabetes mellitus dan hernia? Baik, saya akan mencoba menjawab. Yang pertama, pada pasien diabetes mellitus, harus diketahui terlebih dahulu bahwa orang yang menjalankan dialisis dipastikan fungsi ginjalnya menurun, di mana laju filtrasi glomerulusnya kurang dari 15%. Yang mana salah satu dampaknya adalah kadar gula darah pasien akan tinggi. Kemudian apakah CAPD bisa dilakukan? Pada umumnya tetap bisa dilakukan, meskipun kita ketahui bersama bahwa cairan dialisis salah satunya memang mengandung gula yang bisa diserap oleh tubuh, sehingga berisiko mengalami diabetes yang cukup tinggi nantinya. Akan tetapi kenapa bisa tetap dilakukan? Syaratnya adalah terapi pengobatan diabetes mellitus yang mana melalui insulin tetap harus dilakukan. Seperti apa contohnya? Misalkan pemberian obat insulin melalui injeksi subkutan. Tetap harus dilakukan secara berkelanjutan atau dikatakan tetap patuh menjalankan injeksi secara subkutan, ataupun bisa juga disiasati ya, salah satu terapinya adalah pemberian insulinnya adalah langsung ke dalam kantong cairan dialisisnya sebelum cairan dialisisnya masuk ke dalam rongga peritoneal atau rongga perut pasien seperti itu. Nah, kemudian kewenangan siapa yang menentukan apakah pasien akan menjalankan dengan subkutan atau dengan menjalankan injeksi langsung ke dalam kantong cairan dialisis? Nah, itu perlunya kita kolaborasi dengan dokter, karena biasanya yang menentukan ini adalah dokter, karena ini terkait dengan tindakan medis.
Jadi pelaksanaan pendidikan kesehatan dalam.
Baik. Kemudian yang kedua, kalau pada kondisi hernia, apakah bisa dilakukan? Kalau seandainya kondisi hernianya adalah sebelum pasien ini menjalankan terapi dialisis, alangkah lebih baiknya memang tidak perlu ya menggunakan CAPD. Tetapi kalau memang ternyata pasien ini menjalankan dialisis, kemudian ternyata dia menunjukkan keluhan terutama di bagian perutnya nyeri sehingga timbul hernia. Nah, ini alangkah baiknya akan dikonsultasikan ke bagian dokter. Kenapa ketika ada hernia tidak disarankan menjalankan dengan CAPD? Karena kita tahu bersama bahwa terapi CAPD ini kan menahan cairan dialisat ya di dalam rongga perut dalam waktu yang lama. Nah, kalau ada cairan di rongga perut dalam waktu yang lama, akan memberikan tekanan pada dinding perut, sehingga terjadi kelemahan pada dinding perut. Dan perlu diketahui juga bahwa terapi CAPD memang terapi dialisis yang menggunakan organ utamanya adalah peritoneum, sehingga diharapkan memang di bagian perut atau peritoneum tidak ada semacam luka operasi atau cedera yang parah di bagian organ perutnya, ataupun tidak ada penyakit-penyakit yang memang berkaitan dengan organ peritoneum. Jadi jawabannya adalah apakah bisa dilakukan terapi CAPD dengan hernia? Kalau memang sudah ada hernia, alangkah baiknya tidak perlu dilakukan, tergantung tingkat keparahan dari hernia itu sendiri juga. Mungkin itu jawabannya, semoga bisa menjawab ya pertanyaan bagus dari Siti Sundari.
Terima kasih, Pak.
Ya, sama-sama.
Okay, thank you very much for the expertise, Mr.
Okay, you are
Hannes.
welcome.
And I list another question to Nurse Dewa Swasadewi from Chantika Novi Zahra from Fatmawati Nursing College. And the question is, what is the best method in intradialytic exercise for dialysis patient, and how do it if both hand affected of shunt for dialysis purposes? Madam Dewi? Okay.
Okay, thank you for the question. This is a nice question. I try to give you best answer. Talking about the method of exercise, regarding for several studies, a lot of method of exercise, but looking for the result, the best method is exercise for the chronic renal failure on dialysis is using 30-minute exercise by pedal or isotonus and stretching after 2 hours running dialysis for the patient with chronic renal failure. And if someone both of hand using line, so the patient can do only for the below of extremity exercise, flexi and extension, abduksi and adduksi, like that. Okay, that's enough. That is enough. the answer of your question, Chantika?
I think it's very fruitful question, answer, Madam Devi. And for the next presenter is the question for Nurse Iga. Nurse Iga, are you ready for the question? Another one question from Siti.
Okay, I'm ready.
It must be a very active student. And the question is, untuk pasien anak-anak dengan CKD, mana yang lebih aman atau menggunakan HD ataukah CAPD? Nurse Iga, silakan.
Thank you, Miss Sestra. Good, your moderator. Thank you very much. Question from Siti Sundari from Nursing Academy Pelni. Question, saya akan menjawab ya pertanyaan dari Siti Sundari terkait dengan pertanyaannya adalah mana yang lebih baik antara terapi CAPD dengan hemodialisis. Jika dilihat dari hasil-hasil penelitian yang saya baca bahwa sebenarnya terapi pengganti kondisi keadaan kronik kidney disease atau yang sudah mengarah kepada ISDR atau kegagalan ginjal tahap akhir pada anak, maka terapi transplantasi merupakan terapi yang paling baik. Namun kondisi melakukan transplantasi ini cukup sulit di Indonesia sehingga memang pilihan untuk membantu fungsi dari ginjal adalah jatuh kepada hemodialisis dan peritoneal dialisis. Namun kalau dibilang mana dari kedua terapi itu yang paling baik pada anak, berdasarkan literatur bahwa beberapa penelitian mengatakan bahwa peritoneal dialisis pada anak itu merupakan terapi pengganti ginjal yang lebih baik dibanding HD. Kenapa? Karena dengan menggunakan peritoneal dialisis pada hasil dari penelitian bahwa pada kualitas hidup anak pada seluruh dimensi atau domain itu lebih baik dibandingkan pada anak-anak dengan hemodialisis. Namun kondisi melakukan peritoneal dialisis ini juga harus melihat kepada kondisi klien. Pada kondisi-kondisi anak dalam kondisi yang akut, mungkin pilihan hemodialisis adalah pilihan yang terbaik. Nah, setelah pada saat anak sudah mengalami kondisi yang sudah cukup baik, maka jika memang memenuhi syarat untuk dilakukan peritoneal dialisis, maka anak itu juga bisa dilakukan terapi peritoneal dialisis. Jadi melihat kepada kondisi anak. Mungkin itu, Miss Estra, bisa menjawab pertanyaan dari Siti Sundari.
Terima kasih banyak atas sharingnya, Bu Iga. And the other question for Nurse Fitri Anissa. Are you ready, Nurse Fitri?
Yes.
Mind to answer the question from Siti Sundari again, from Pelni, Jakarta. Bagaimana program diet yang baik untuk anak usia sekolah and obesitas in this COVID and when they are in immune system reducing? Time is yours.
Okay, thank you, moderator. Okay, since the Siti Sundari use bahasa Indonesia, I will use bahasa Indonesia too for answering the question ya. Oke, thank you. Terima kasih. Pertanyaannya sangat baik sekali ya, Siti Sundari dari Akper Pelni. Bagaimana caranya melaksanakan program diet bagi siswa yang mengalami gangguan nutrisi pada masa pandemi COVID ini ya. Tentu kalau misalnya di sekolah, tadi seperti tadi research yang telah disampaikan ya, yang tadi ada beberapa. Jadi memang ada beberapa program sekolah kalau misalnya tidak dalam kondisi pandemi ya. Misalnya dengan program makanan dari sekolah, kemudian aktivitas seperti senam, ya segala macam. Nah, kalau di masa pandemi seperti ini, biasanya sekolah bisa berkolaborasi dengan orang tua ya. Kadang kalau anak SD itu kan suka ada jadwalnya ya, jam sekian sampai jam sekian itu anak-anak harus senam ya. Jadi memang kolaborasi dengan orang tua. Kemudian bisa juga kolaborasi dengan gizi. Sebetulnya untuk anak ini berapa sih kebutuhan kalorinya ya per hari untuk supaya dia mencapai nih target ideal berat badan ya. Jadi menu makanannya apa saja. Jadi kalau bagusnya sih kalau di masa pandemi seperti ini kolaborasinya banyak nih, ada dengan orang tua dan juga dengan ahli gizi. Jadi dengan ahli gizi menentukan menu makanan berdasarkan kebutuhan kalori dan orang tua memantau ya aktivitas dan segala macam seperti itu ya. Jadi sekolah hanya memantau saja. Oke. Ya mungkin itu dari saya, moderator. Thank you.
Terima kasih untuk expertise-nya. And for the next questions, there is a few questions actually, Nurse Ayudania Agustin. Are you around? And the question, if I can conclude, there is from the 3 questions, that is it allowed to direct breastfeeding for the mother who with the COVID? And the other one, if the KMC is given 24 hours, how do it? Okay, you can use in Indonesia since there is no expertise from the overseas anymore, isn't it? Nggak ada lagi kan expertise dari luar? Silakan untuk misalkan menggunakan bahasa Indonesia, Bu Ayu. Terima kasih.
Ya, terima kasih Bu Ises dan juga teman-teman yang sudah bertanya. Untuk pertanyaannya kurang lebih sama, jadi saya menjawab secara keseluruhan saja. Untuk apakah aman menyusui pada saat pandemi sementara ibu dinyatakan positif COVID? Kalau berdasarkan beberapa penelitian yang saya baca dan juga rekomendasi dari WHO, itu tetap diperbolehkan untuk menyusui. Kalau yang lain melihat kepada transmisinya, tapi kalau untuk di kondisi bayi baru lahir dan juga anak-anak justru ini sangat diperlukan, ASI itu sangat diperlukan sehingga WHO merekomendasikan untuk tetap menyusui, ibu menyusui, namun perlu memperhatikan pencegahannya. Nah, apabila ibu tersebut dinyatakan positif COVID sementara dia tidak ada di rumah sakit, dia bisa melakukan menggunakan masker, kemudian juga dia harus sering-sering mencuci tangannya. Ya, dia harus sering-sering mencuci tangan, kemudian dia menggunakan masker. Nah, kemudian apabila ibu yang positif COVID tersebut ingin memberikan ASI, sementara dia batuk dan batuknya sampai tumpah ke percikannya sampai tumpah ke dadanya, maka sebelum dia memberikan susu atau menyusui bayinya, dadanya itu dicuci dulu, gitu ya. Nah itu kemudian juga untuk yang KMC, untuk KMC sehari apakah bayi harus dalam pelukan ibu selama 24 jam penuh? Jadi KMC itu ada 2 macam ya kan, ada intermittent, ada yang continue. Intermittent paling sedikit dia dilakukan selama 2 jam atau 120 menit dan yang paling lama memang 24 jam ya. Dan yang continue itu biasanya pada saat bayi sudah dipulangkan dari rumah sakit, maka itu bisa dilakukan oleh ibunya sepanjang hari gitu. Dan mengingat manfaatnya boleh dilakukan dalam 24 jam, namun diperhatikan juga kondisi ibunya. Kalau kondisi ibunya kelelahan mungkin ya, nah itu bisa bergantian dan tidak hanya ibunya saja yang dapat melakukan KMC, tapi juga bapaknya ya dapat melakukan KMC. Penelitian yang saya lakukan di Rumah Sakit RSAB Harapan Kita waktu itu meneliti tentang hubungan antara hipertermi. Jadi ada nggak sih pengaruhnya pemberian KMC terhadap penurunan demam ya pada bayi? Nah ternyata itu ada hubungannya gitu. Jadi kalau misalkan ibunya kelelahan melakukan KMC, maka digantikan oleh bapaknya, dan selama kami melihatnya itu selama 1 bulan ya, jadi beberapa kasus. Nah, ternyata terjadi penurunan suhu ya pada bayi-bayi yang mengalami demam ketika sering diberikan KMC itu dapat turun suhunya. Dan begitu juga penelitian yang saya lakukan dengan mahasiswa untuk melihat apakah ada pengaruhnya pada saat kita melakukan KMC dengan kenaikan berat badan. Ternyata itu juga ada. Dan mungkin kalau kalian bisa baca, banyak sekali manfaat-manfaat yang ditemukan dari KMC atau perawatan metode kangguru. Dan ini sangat-sangat direkomendasikan untuk kita ya. Jadi walaupun di masa pandemi ini kita tetap bisa melakukan KMC gitu. Dan bahkan waktu yang tahun 2016 ini saya melakukan KMC bayi O yang kasus pertama tadi, itu bayi O dia kembar 5. Jadi mungkin kalian tahu yang dari Cirebon, kembar 5, bayi A, I, U, E, O. Nah, ibunya itu melakukan KMC sering sekali, 3-4 kali. Dan sekali KMC itu 2-3 jam gitu ya. Itu dilakukan pas saya tanya, kenapa Bu kok sering melakukan KMC? Karena saya yakin anak saya akan sehat, akan cepat pulang ke rumah dengan melakukan KMC. Ada keyakinan tersendiri dari ibunya. Dan siapa sih yang paling berperan untuk melakukan KMC ini? Kalau di rumah sakit yang paling berperan sebenarnya menurut saya dokter dan juga perawatnya gitu ya. Saya menemukan kurang optimal KMC-nya dari si perawatnya ini sendiri kurang gitu ya. Jadi sebaiknya itu memang perawat-perawat di rumah sakit itu memberikan edukasi terkait dengan KMC. Mungkin memang sudah dilakukan pemberian edukasinya, namun mungkin belum clear ya, belum jelas, sehingga yang diperlukan adalah kejelasan dalam pemberian informasi tersebut agar tujuan yang diharapkan untuk melakukan KMC itu tercapai. Begitu Bu Isas. Terima kasih.
Banyak Bu Ayu terhadap pengalaman, sharing, dan knowledge-nya. Dan kita tiba kepada pertanyaan terakhir untuk Nes Putri Permatasari. Sama dari Siti Sundari juga, dari Akper Pelni Jakarta, mengenai apakah acupressure point GP21 itu dapat diterapkan pada pasien menjelang kelahiran untuk bisa memperlancar kelahiran tersebut. Kepada Nes Putri Permatasari.
Oke, terima kasih atas pertanyaan diberikan oleh Siti Sundari. Pertanyaannya sangat bagus. Di sini pertanyaannya apakah akupresur bisa diterapkan pada pasien yang menjelang melahirkan. Nah, di sini akupresur GB21 itu memang salah satu manfaatnya itu untuk menstimulasi pelepasan oksitosin. Tetapi untuk sampai saat ini terapi akupresur GB21 itu penelitian dilakukan itu hanya untuk pasien yang setelah postpartum. Nah, postpartum dan postseksio sesarea yang nantinya hasil akhirnya itu untuk melancarkan ASI dan membantu ibu untuk rileks, melancarkan aliran darah pada payudara. Kemudian di sini tentunya sebelum melakukan intervensi sebagai peneliti sudah mengikuti pelatihan sertifikasi akupresur GB21 ini. Nah, saat mengikuti pelatihan terlebih dahulu itu di sini justru GB21 itu dikecualikan untuk ibu yang masih dalam masa kehamilan atau masih mengandung. Jadi seperti itu. Jadi belum ada sumber yang mengatakan bisa digunakan pada pasien yang menjelang persalinan. Jadi GB21 ini yang saya ketahui hanya untuk pasien yang postpartum seperti itu. Baik, demikian yang bisa saya untuk jawaban dari Siti Sundari.
Oke, Thank you for
Yan.
the
Saya jawab lagi nih yang ini.
Nurse Putri. Because of time's limit, so I will end the session. Finally, we come to the end, and I would like to thanks again for all the presenter, for the oral presenter, for the informative, fruitful, and interesting oral presentation. Hopefully, the presentation very beneficial for all of us, including especially me. And thank you for the participant to be remain in this hectic hour to be sleep and pray. And I would like to give it back to the master ceremony. Thank you for your attention.
Thank you to moderator and also to all presenter. Now we are going to take some photo. So please to all participants, switch on your camera and give your best smile. Please hold until the session ends. We will tell you when it's done.
Sekarang, kami akan mengambil gambar untuk dokumentasi. Dipersilahkan kepada seluruh peserta untuk menyalakan kamera dan memberikan senyuman terbaiknya. Mohon untuk menahan posenya sampai dengan akhir sesi foto. Kami akan memberitahu jika sesi foto sudah berakhir.
Saya main Zoom.
Screen 1, please smile.
Hanya suruh foto terakhir.
Screen 2, smile.
Suruh senyum.
Screen 3, smile. And screen 4, give me smile. Screen 5, smile. And also screen 6. Okay. 7, smile. And also screen 8. And next, screen 9.
Pinter nih mahasiswanya, bahasa Inggrisnya lancar jaya.
Okay, next, screen 10. Okay, next, screen 11. And next, screen 12, smile. Please, on screen 12, to switch on your camera. Okay. And now, before we end, to all participants, I kindly invite all of you to fill the link evaluation that will be distributed on Zoom and YouTube chat room to get certificate. Or you can see it on the screen and type in on your browser.
Kepada para hadirin sekalian, sebelum mengakhiri acara, dipersilahkan untuk mengisi link evaluasi yang akan disebarkan di chat room Zoom dan juga YouTube untuk mendapatkan sertifikat. Jika sudah, Anda juga dapat melihatnya melalui link yang akan ditayangkan di layar Anda dan mengetiknya di browser Anda masing-masing.
Or you can see it on the screen and type in on your browser.
Pada para hadirin sekalian, sebelum mengakhiri acara, dipersilahkan untuk
Ladies and gentlemen, that's the end of our International Nursing Conference today.
Untuk mendapatkan para hadirin sebagai sekalian, dengan begitu maka berakhir sudah seminar internasional keperawatan kita kali ini.
And we would like to see you again on the next International Nursing Conference. Thank you very much and goodbye.
Terima kasih dan sampai jumpa dalam seminar internasional keperawatan berikutnya.